Good afternoon. We're here for our regular work session meeting, Tuesday, April 16th, 2024, 1:30 p.m. Our first appointment today for this work session is not that. That was April 16th. It's to welcome the Banner Wyoming Medical Center folks and the Collective Healthcare Trust folks. We had asked for the Collective Health Trust and the Banner Wyoming Medical Center folks to come back. We saw you in mid-April, and thank you for your presentation. Thanks also for coming back today. The commission felt that we didn't have enough time to ask you some questions and kind of dive off into some of these areas that we thought were important to our community and this commission. Unfortunately, at the day you last were here, we had a jam-packed agenda, and we didn't have an opportunity to really get into some of those issues. And I think that we as a commission thank you for prioritizing us. I know you all are very busy and are doing a lot of different things, and so we do thank you for making time to come back to visit with us. In our jury box, we have three of the members of the Memorial Hospital Board of Trustees. Usually they take a back bench, and they speak when spoken to. And I think that it's nice to have them up here a little closer to us. I know that the history of the Memorial Hospital Board of Trustees goes way back, well before any of our times on this board. They are currently a 3-member group, and we're looking to fill the group, fill it out to a 5-member group. And I think we've had some recent indications of interest in that respect. And so we'll see if we can get a couple more board members. My thinking is that we, for today, we have a little flexibility on how we do this. I see 2 empty chairs in front of me, and the first, I'll call it a pew, is empty here. Commission, do you have a preference on whether we visit with Banner Wyoming Medical Center folks first, or Collective Health Trust folks first, or should we invite a representative of each to our table of 2 chairs? Any preference? Then I think what we'll do is that, Mr. Porter, I'd invite you, and Ms. Worthen, I'd invite you to come up to the table. And to the extent that you need to defer to other members of your group present today, we would welcome that. So, good afternoon.
Good afternoon.
I think that I've probably said enough already as introductory remarks. I would open it up to either Commissioner Laird or to Commissioner Friel for some initial questions or areas of questioning. Commissioner Friel, are you prepared?
Yeah, I'll start. When you were here last, Mr. Porter, I did have a series of questions I wanted to ask, and they're not all from me. Obviously, some are going to come from the public itself. But looking back at your presentation, I noted that you have 15 different positions. Obviously, it's a big hospital, but you have 15 open positions. And during this, you'd made a couple there's some comments in here about being declined due to fitness and background for the hospital itself. it seems that when it was Wyoming Medical Center before it was Banner, we didn't have any issues with good, top, high-quality doctors being here. It seems like a majority of them that I've personally known over the years are all gone now. And going through this presentation, it just seems like there's a lot of open positions at the hospital. So my first question is, how are it seems like there's more hospitalists in there and not doctors, and I may be wrong in the way I just said that, but how are you going about recruiting and filling these positions? Because it seems like there are certainly a lot of open positions up there.
Mr. Chairman, members of the commission, Commissioner Friel, thank you for that question. When you say there's 15, the number that I recall about 15 were the 15 providers that we actually hired and brought here to Casper. They weren't departures; they were actually physicians that were recruited. And so, but we do have some vacancies. And just to give you an update, as so far this year, we have signed 10 additional contracts with providers already in 2024, and we have 5 other contracts out pending. And those include important subspecialties such as pulmonology, which we've been recruiting for a while and is a very critical point. We actually have some really solid candidates right now, and so 15 last year, 10 already this year, with 5 contracts being put out. That's a good recruiting year. You did mention hospitalists versus docs. I just want to make sure I clarify that. Hospitalists, their main job is to care for patients once they've been admitted at the hospital. 20 years ago, we had the retirement party for Dr. Burke the other day, and as a private practitioner, he would run his primary care practice, and then at the end of the day, he'd come around at the hospital. That changed to a hospitalist model about 20 years ago because those primary care doctors were getting burnt out, running a busy clinic and then still trying to round at the hospital. And so every hospital across the country just about has adopted a hospitalist model, and that's what they do. You've got your orthopedic surgeons that do the surgery, then they admit them to the hospitalist model, and they do the follow-up care with consultation from the specialist until discharge. That's a standard model. So if you see more hospitalists, that's why. They're there doing the day-to-day care for the patients and then pulling in the specialists for consultation. That has been the standard model across hospitals for quite a while now. Although I still do get complaints from older members of our community that still want to see their primary care doctor in the hospital, but most of those doctors don't want to. They want to run their clinic and turn things over to the hospitalists. But again, that's nothing new.
Okay. Then a follow-up question to just what you said, that a lot of people want to see their doctors in the hospital. I didn't really think it was an issue until it became an issue for me, but it also seems like there are a lot of doctors that have been with Wyoming Medical Center, and now that they're under Banner, they're leaving. They're going elsewhere. It was kind of out of sight, out of mind until mine left. And, so in seeing that happen quite often, a lot of people complaining about the fact that their doctors are no longer providing here, or they're providing here but not under Banner itself. In my particular situation, mine left and went to the VA.
Dr. Lloyd, yes.
Yeah. So I guess my question is there an explanation as to why there's such a mass exodus of doctors to that affect people? It shouldn't affect me because I am a veteran. I'd be able to go and get VA benefits, except for there's a few things involved in that that don't allow me to go over there. So now I get to start all over again with another doctor. And so I guess to put it out to the public, is there a reason why there's such a mass exodus and some people are having to start all over again with a new doctor?
Yeah. So, Mr. Chairman and commissioners, that's a very good question, and one that I have spent a lot of time thinking about, because obviously you don't want to lose good doctors. It's easier to keep somebody than it is to recruit somebody. But as I look back on that over the last 3.5 years that I've been here, I think I can put them into maybe 4 buckets on why a physician would leave this community. The first one is, and this happened early on, is there were doctors that were already considering leaving the community when Banner Health bought the hospital. I've transitioned 2 hospitals now for Banner Health, and that's pretty standard. People aren't happy with the community. They're not happy with, the situation. They're already thinking about it. And instead of going through a large transition, they use that as an opportunity to make a change in life. I can name 2 doctors off the top of my head that they made that decision. They were already thinking about it. And that big change was enough incentive to move them to that. I think also another reason is you have doctors that were used to operating under a model where it was an independent facility. Things were done differently. Things were more streamlined. Things can be done easier under an independent hospital than within an integrated healthcare system. And so there were some doctors that decided that they didn't want to be part of a healthcare system for a variety of reasons. And so they have decided to change employers because they moved here because it was an independent hospital. They could practice the way they wanted to. They made a lot of the decisions. And with Banner Health coming in, it's an integrated healthcare system. They have ways of doing things that has been proven across 33 hospitals across the country and standard best practices. That's not for everybody. And I respect that. And so people have left. I think we've lost a couple other doctors as well because this is a little harder topic to discuss, but when we came here, there needed to be a culture change. There were a few doctors left because we began coaching them on their behavior, that it was okay to cuss out nurses and staff, to try and physically intimidate staff members. And we began to coach that was a practice many, many years ago, and it's no longer acceptable. I'm sorry that doctors have felt strongly enough to leave, but I'm not going to apologize for protecting my staff and adopting a culture which has been adopted throughout the United States, that kind of behavior is no longer acceptable. There's been many doctors that have thrived under that. We've been able to attract doctors that thrive under that, but there have been a few doctors that have decided to look elsewhere because we began coaching them on their behavior. So, and then the 4th group is, again, as I talk about the differences between a independent hospital and a hospital system, one of the major differences is under an independent hospital, the local physicians used to make a lot of the decisions. It was a physician-driven culture and program. Banner Health is not physician-driven. It's not physician-led. It's led by a system that includes many talented physician executives, but there's also nurses, MD PhDs, there's executives that are highly talented that come together to look at policies, procedures, the way we do things. And it's not a hospital, no longer a hospital that's led by local physicians. And that's a change. And when the hospital was sold to Banner Health or any system for that matter, whether it was HCA, University of Colorado, that's the way they operate. But it is a change, and that change is sometimes tough to adapt to.
Mr. Porter, following up on that comment and from Commissioner Friel, you provided 4 reasons, the buckets. And I have heard that people like Dr. Lloyd and a rheumatologist left because they weren't feeling supported and they were feeling overworked. Is that not an issue? And if it is an issue, how are you going to solve that?
So it's really tough to talk about those 2 specialists without getting into very private information about those doctors and their practice. What I can tell you is that Banner Medical Group has come in and provided considerable amount of support. Again, if you had been at the retirement party for Dr. Burke, he talked about the support that he's received from Banner Health. The scribes, the mid-level providers have been brought in, but we do require a certain level of productivity. One of the biggest issues we have is access and getting in a timely manner to see your primary care doctor. And so Banner Health has a high level of performance, willing to put that assistance in there, but there also are high requirements. And so we've tried to add a lot of support to these primary care providers to attract them. People have chosen whether they want to work in that environment, and then where we have vacancies, we've been recruiting people who will thrive in that area. Did I answer your question?
It's responsive to my question.
Okay.
Thank you.
Yeah.
Commissioner Laird.
Good afternoon. I'm going to read something to you and then ask you to comment on it if you care to. I get a lot of people complaining about your hospital. Doctors, people who have been there for treatment, more so than I've ever heard since I was able to understand complaints against hospitals. And I'm one of the guys that was on the Wyoming Medical Center board in the late 80s and early 90s. So I have a particular knowledge of a lot of those doctors that are still here and that are retired. But this was something sent to me by a person who's really unhappy with your hospital. Wasn't said by them, however. Huge rant. Banner Health. My son and I watched them neglect an elderly man in the ER. This poor man was slumped over, vomiting in his wheelchair. They made him wait an hour. We went back to get my son's vitals done, came back out, and the gentleman is still slumped over, this time with a pool of blood everywhere. I tried to tell the front desk girls. All they had to say was housekeeping is on the way. The housekeeper asked the girls to move him, and then they realized he was dead. It was the most disgusting and awful thing I have ever seen at that hospital, that poor man. And then this guy says this to you: do better, Banner Health. Fix your crap before this gets worse. So I got that, and then I have people that say they can't get the medical records. It's been a month or something. They can't get the medical records, and they get all these excuses from the hospital. And then it turns out that your emergency room doctors won't sign this gentleman who died, won't sign his death certificate. Had to be turned over to Dr. Dowell, who got some sketchy medical records and signed the death certificate. And then I get some information that your hospital has been determined to be not in compliance in the ER. Are you familiar with those things? Particularly the non-compliance findings of the federal government?
So is that your question to me?
Yes.
Okay, so I'm free to respond.
Oh,
So,
absolutely.
Mr. Chairman and County Commissioners, Commissioner Laird, so you're referring to a patient that we have been very transparent about, reported to the trust. We've
On
talked about this.
On the first issue, that is something that was on Facebook. The
Yes.
second issue was the issue about, have you been found to be non-compliant by
And
the
so
federal
the
government?
two are related, Commissioner Laird. When you have a situation like that, no matter what hospital you're in, an unexpected death, the Department of Health comes in and surveys. And they want to make sure that you are handling it correctly, that you have an action plan to address that situation and make sure that it doesn't happen again. And so, yes, we did have the Department of Health come in and worked with us on an action plan. It's an EMTALA area, making sure that people have access to care. And yes, that was an unfortunate situation, and it is multifactorial why it happened. The action plan is multifactorial, and the action plan has been approved by the Department of Health, and we're working very closely with them to make sure that that is resolved.
So let me read that to you. It's a Department of Health and Human Services, and it says, initial comments. A complaint health survey for compliance with the Emergency Medical Treatment and Labor Act, 42 CFR Part 489.20, basic section commitments relevant to Section 1867 responsibilities, and 42 CFR Part 489.24, special responsibilities of Medicare hospitals in emergency cases, was conducted from 2/28/24 through 2/29/24. The survey was prompted by a complaint intake, and they gave the number, Y0003808. Based upon the findings of the survey team, Wyoming Medical Center was found not in compliance with the requirements for A, A-2400 and A-2406. Wyoming Medical Center was previously cited, this isn't just this one, previously cited for a A-2406 during an EMTALA complaint investigation. And that was Y003704 with an exit date of 12/5/23. It's been going on for a little while, apparently. The facility had an approved plan of correction with an alleged compliance date of 2/29/24. The plan of correction included education to staff and chart audits to ensure a full physical exam and visual acuity exam for any complaints related to the eye. The facility was in the process of implementing the action plan at this time of this newly identified example of noncompliance at A-2406. The incident occurred on 2/26/24. Review of the facility, a internal action plan provided by the facility on 2/29/24 showed the following corrective action. A, initial event, fact-finding, meeting, and human resource investigation took place on February 27/24. On 20/28/24, another meeting was held. 2 staff involved were placed on administrative leave, and senior leadership started rounding in the ED. That's what this says. You've probably seen it.
I'm sorry, Commissioner Laird, what is the report that you're actually reading from?
It says laboratory director or provider's supplier representative signature, and that was signed, I can't read the signature, but the top of it says Department of Health and Human Services, Centers for Medicare and Medicaid Services.
Yeah.
Statement of deficiencies and plan of correction. There's 2 of them here, and they deal with the EMTALA laws, which you are familiar with, of course.
Because what it sounds like is that is the action plan that we put together in collaboration with the Department of Health. And so all those points were things
But
that
you
we
were
put
out
in
of
place.
you were out of compliance before this guy came in, and then this happened to the guy, and people are outraged about that. You can imagine that, right? And so, but it's not just that one that I have a lot of people call me, and it's disturbing to me as a commissioner, because they want us to let you sell the hospital. They want us to buy the hospital back. They want us to start another hospital. They're going to Douglas. They're scared. And when you come in here, it's all roses, but it isn't all roses out there with the people. And so I'm just pointing out to you, your transparency level has a problem. And I get complaints from these homes that send people in there. Some little lady goes in there, her hand's hurting. They say, our hand's broken. Your people give her, send her back in 30 minutes and say there's nothing wrong with her hand. They send her to another doctor, x-rays her, and finds her hand's broken. Little old lady said, go out there and die 2 days later after you send them back, say nothing's wrong with them. Now, I don't know any more about it than that, but I have people calling me saying these things. Some of it I do know the truth of, other ones I don't. I don't like dealing in rumors, so that's why I read you the 2 things I did that seems to imply some large failures up in your hospital. And then when I get these doctors coming into my office, more doctors than's ever been in my office, complaining and worried about their own medical care. This is a real problem for you. Now, all I'm doing is pointing it out to you because it's being pointed out to me. And what I say, I don't believe I have any oversight over the hospital. Wish I did. I wish the hospital had never been sold to your company. As I understand it, the federal government's looking into a lot of these things. And even the Biden administration, which kind of surprises me. So I don't know what to tell you. You can make whatever response you want.
Mr. Chairman, commissioners, I have never heard of the Biden administration interested or investigating anything at Wyoming Medical Center or any federal investigation other than the one HIPAA situation, not HIPAA, EMTALA. And we were not out of compliance. We had some issues we were taking care of. So as long as had an action plan to fix it and we were moving down that road, then that is what the Department of Health wants to know about. And so if we are ever out of compliance to a serious effect, they will shut us down. And we have not been shut down. Matter of fact, we just had a Joint Commission survey for our stroke program, and we will be recertified for that. And Joint Commission, that's what they do, is they are the regulatory body for the United States. They come in for Medicare, they survey, they make sure you're following policies and procedures. If it's at risk, they will shut you down. But the surveyor's response to us was, you have a very well-run program here. And she has seen stroke programs across the country.
You keep getting back to strokes. I didn't mention anything about that, except I have talked to people that were involved in the stroke program, and they tell a totally different story than you're saying here to these commissioners.
Okay.
And I'm not going to invite these guys down here because they don't want to have problems, but they're not saying the same thing you're saying. They're just not.
Well, Commissioner Laird, we're talking to different people then, because we recently took a trip up to Buffalo where we support them in stroke care. And their response is the system now is much easier to access, it's much easier to use, and they've seen a real improvement. And so, again, Joint Commission is the gold standard. Joint Commission, if there is an issue where people are being put at risk, they will come in, they will shut us down, they'll take away our certification. And they will be recertifying us for another 3 years.
So what can you do? I'd like you to do one little thing. And that is somehow gain the confidence of our elderly people because they're scared. They don't want to go to your hospital. And this makes me sad. I want to cry over it because they come up to me when I'm in a restaurant and say things to me about it. And they're scared. And if you're not hearing that and you don't feel that, then you're out of touch with the people of this county. And I'm just concerned for the health and welfare of our people. And yeah, I know there's things that can happen in hospitals. People die in hospitals. We have good doctors. We have good nurses up at that hospital. But then I have nurses call me and they say, well, we heard you guys are going to buy the hospital, and there's a bunch of nurses that sure like to get their jobs back. I get that kind of call. Now, what am I supposed to think of that? It's a tough job we all have. But, it just goes on and on. Thank you for coming down.
Mr. Chairman, Commissioner Laird, we rebuild that trust day in and day out by providing good care. We provide care 365 days a year. We've got exceptional doctors. We've got exceptional nurses. I am not going to back away from the tragic experience that happened with that ED provider, that gentleman in the ED. That was tragic. We are making sure that will never happen again. But it is a complex organization. And you're hearing from people that are very upset, and they may have reasons to be upset. But you're probably not hearing from the people who really enjoy working for Banner Health, from the patients. I get letters all the time from patients that are saying what great care we had. I shared a stack of them with the trust when we gave our annual report. That's not to say that there's people that are having bad experiences, but every organization works through those. I see every complaint that comes through. I look through them. I read the chart on every single complaint to make sure that we're addressing where it's appropriate. Sometimes there's not much we can do. I think probably the most common complaint that I get is, I came in to the ED and they didn't address, my broken finger. And we do some education that, the ED physicians are not there to address a broken finger. They're trained to do life and limb. And so what they'll do is they'll make sure you're safe, and they'll make sure you're stabilized, and then they will discharge you to orthopedic specialists who that's their job. But that's a misunderstanding for a lot of people, and that's not what an ED physician does. And so it is addressing every single complaint that comes through and spending time. We get on the phone and we talk to every single complaint to make sure they understand and get a response. And so we've gone through that. We even have a text the CEO where people can text me or a member of my senior leadership team 24 hours a day. And we review those on a personal level. There's not many people that are willing to do that, but we're doing that. We're willing to go up to the unit and kind of resolve issues when they happen. That's the level of commitment that we've put into this. And again, it's day by day. It's little by little. It's recruiting good doctors, recruiting good nurses. Again, this year we have a very low turnover rate, equal to that of what it was last year. Our neuro unit just was recognized for having the one of the 3 top highest patient satisfaction scores in the entire Banner Health system. That doesn't happen if everybody's revolting and everybody wants to leave. That's a healthy culture. And so there are a lot of metrics that we look at, and a lot of people that we talk to on a daily basis that appreciate the changes, appreciate the resources that Banner Health has brought. You know, I think it's easy to point the finger at Banner Health as the big corporate bad guy. But if you remember, one of the reasons we sold the hospital is because they weren't producing enough revenue to invest back in the hospital with capital. And so that's where Banner came in, as they were able to provide capital, guarantee capital for the next 10 years, so we can start building programs and bringing doctors here and programs that we haven't had before. So you look at the level 2 trauma program we have here. There's no other program like that in the state. We're building a $7 million EP lab, bringing electrophysiology here. That's 300 patients a year that go outside of the state of Wyoming for care. And we're investing in that to make it happen. There's a lot of things that are good that are happening.
So what happened up
but there
in
is a
Lander?
lot of change as
What
well.
happened up in Lander when Banner bought that hospital up there and got rid of it? What happened up there?
Mr. Chairman and Commissioner Laird, Banner Health has never owned a hospital in
Or
Riverton.
was it Riverton?
No,
Maybe it was
they've never
Riverton.
owned a hospital. That's owned by Sage West,
This
which is a
was what-
for-profit
This was a
hospital.
few years back. This was a few years back.
No, they
What-
own
what
we
was
own the
what
hospital
was
of
the little- what was-
Worland,
What was the
Torrington,
little
and Wheeling.
hospital? What was the little hospital down in Arizona that you were working at before you came up here?
Payson Regional Medical Center became Banner Payson Medical Center.
And so, is it still a Banner hospital?
It is, yes.
And who's the CEO there now?
The CEO is Hoyt Scabland.
How long were you at that hospital?
I was there for 7 years.
And did you live in Payson?
I did. Raised my children there
So,
through high school.
Why is it we're hearing so much? Now, I'm going to be fair. People come up to me and ask me these questions, and then I say, well, have you know anybody that's been there? And I have 2 people who've said that they got good treatment up there. Now, they were both wealthy people. I don't know if that makes any difference, because there's some people that aren't wealthy that go there and they think they're being turned away. They're being given short shrift. They're in and out of there so quickly. And there's some of these people out in the community that just don't think that some of these elderly people are being taken care of properly. Now, that's their opinion. And so all I'm interested in is seeing somehow you can do some PR where people aren't afraid to go to your hospital, because I think it's dangerous for them to maybe have to drive to Denver or anywhere else if they're having serious medical problems. I'm afraid for these people.
Mr. Porter, you mentioned that Banner has a high level of performance standards. One of the things that I've heard is there's a desire to, and you've incorporated getting a system or a process to get patients in faster. And one of the things that I've heard that instead of hiring adequate staff to handle, it is overworking the existing staff you have, and that your appointment times are being overlapped, so that you've got a 45-minute appointment, but it's overlapped by 15 minutes. And so you're really compressing the time that you're seeing patients into about a 30-minute increments, which for some cases is, I think, pretty clearly insufficient if the standard of care would indicate a longer amount of time. And in fact, if your appointments are 45 minutes, that would also indicate that that's maybe the standard. So talk to me about the current practice of getting those patients in and overlapping appointments, because I've heard that's a problem.
Yeah. So, Mr. Chairman, thank you for that question. I'm not the expert in running a physician clinic. Maybe Steve Cobb, who has run physician clinics, can be more eloquent than I can. But there are standard accepted ways to run primary care clinics, and you set schedules based on a certain amount in order to have access and have a certain productivity to make sure the doctors are seeing as many patients as the need is. There is a lot of room for growth within our primary care clinics. We can open up, we can see more patients safely. And we just recently looked at making schedule changes so that we can see more patients. We also are making changes to our pharmacy program. So that is a huge burden taken off of the doctors, so they don't have to go in and do every pharmacy or prescription refill. So while we're also asking them to do more, we're taking things off their plate so they can spend more time with patients. That pharmacy program went live, I believe it was last month. We're working slowly with some bugs, but again, when I recently talked to Dr. Burke, he said is awesome was his words. It has made his life a lot easier because these are just check boxes that he has to go through for pharmacy to get prescription refills, and it's a lot of burden on the docs. That is being taken off of their plate. So while we're looking at, yes, we need to see more patients, we're also looking at how do we get more stuff off of your plate. So, Steve, would you share anything else?
Mr. Porter, do you feel you're fully staffed then when it comes to primary care physicians, nurses, and other staff members?
I am not the CEO of Banner Medical Clinics. That is a change as well. I'm over the acute care hospital. We have Banner Medical Group and a local administrator.
Well, let me just tell you, I respect that. That's maybe somebody else's area of expertise, but can you get back to me on that?
Absolutely.
Okay.
Absolutely.
Commissioner Friel.
The only other thing I wanted to do is just follow up on what Commissioner Laird was asking, and it comes back down to quality of care. And I think the biggest question that I have, and I don't know whether you get an answer to it or not, is what is the quality of care here? Because there are so many people, as Commissioner Laird had mentioned, there's so many people that would drive 50 miles to Douglas and they feel like they get better service and better treatment down there than what they're getting here. There are people that are going to Denver, driving 4 hours to take care of things, going to Salt Lake. And I just don't quite understand why it is that our people feel that they need to leave the state of Wyoming to go to Colorado, Utah, or drive 50 miles. If you got something wrong with you, drive 50 miles as opposed to driving 3 miles to get it taken care of. That's a concern. It's a concern of mine when it comes down to that people are willing to make that kind of a drive to take care of an issue that they have going on right now.
Mr. Chairman and Commissioners, Commissioner Friel, that's a very good question, and there are a lot of different metrics that we look at, but out-migration is what we call that, is people who feel they need to go somewhere else for care is something that every hospital looks at and tries to solve. Even before Banner bought the hospital, out-migration was an issue. There are people that feel they can't get good care here, so they have to go to Denver for a variety of reasons. But that's the challenge that we have as administrators. Part of our everyday strategy is how can we then improve the perception of care, make sure our outcomes are good, bring new services here so that people don't feel like they have to. And that's a lot, again, day-to-day operations, bringing new physicians, bringing new programs to build that trust. And then if you have a situation like we did in the ED, and that erodes trust, and that's something we have to fight and get back that trust. But again, we're providing solid care 365 days a year, and every patient is important to us.
Is solid care, that I don't like that term. Is solid care what the people of Natrona County deserve?
Mr. Chairman, so again, I said there's a lot of different metrics we look at. One of them is Joint Commission. That is, again, the gold standard. They come in and they make sure we're doing it. We have a lot of bodies like the American Heart Association for our STEMI program, for our stroke program, that actually hold us to a higher standard. Those are the gold standards. If we lose those programs, then there's an issue. And so they look at a multitude of quality metrics.
Mr. Porter, I don't want to judge you based upon one word, but I don't think Wyoming Medical Center was providing solid care. I think they were providing far better than that. And if that's the new lowered bar, I don't think that's the place for our county to be. So I'll give you the benefit of the doubt. But my hope, since I am sure that your hospital, Banner's Hospital at Wyoming Medical Center has lost referrals, has lost patients due to what you say is a perceived, I guess, quality of care, lack thereof. Some might say that it's a real, not just perceived, lack of quality care. So what is Banner's plan, and more specifically, what is your plan to basically restore those relationships, restore those referrals, and to get back to a better place in those regards? And I think that kind of follows up with what Commissioner Laird and Commissioner Friel were saying in terms of this, all the feedback that the commission is getting.
Mr. Chairman, thank you for giving me the benefit of the doubt on the use of that adjective. I certainly, you look at our goal and our vision statement it's not average care. My use of that term is not equivalent with average. We want to provide a high level of care. We see ourselves as the tertiary referral center for the entire state of Wyoming. And you just can't say you're that. You have to prove it. And so that takes a lot of effort on our part. To answer your question on what are we doing about that, so number one is, as I said before, is we're recruiting good doctors, bringing new services that people have heretofore had to go to Colorado, Montana, Salt Lake City for. That's one thing. The other thing is solidifying our referral sources. So the 12 hospitals that we see as spoke sites. One of the things that we've really struggled with, and this is transitioning to a new culture. If you remember, part of the agreement is we need to be that referral center. That's in the agreement, that we should be the referral center for the state of Wyoming. Creating a yes culture. We have moved to saying yes to 95% of the referrals from these outside communities. The problem is now in getting to a quick yes. Now, that would be easy for me if I employed every single doctor in Casper, but I don't. And so that takes collaboration, takes teamwork, that takes working with independent doctors on how do we get to a yes quicker for these patient referrals. I think we've had some success. And when you look at volume, our volume this year is higher on every single metric over last year. And so, are we the same as we were back in 2018? We're still lower than that in some areas, but we are making year over year progress. And so I think that when we talk about rebuilding trust, I think that's evidenced. We're higher this year than we were last year in inpatient surgeries, outpatient surgeries, ED visits, and admissions. And that's 2 years now without COVID. So that's year over year progress in a non-COVID world. And so there's a lot of metrics that are pointing to the fact that we're making a lot of good progress and we're doing a lot of good things.
There was a ICU doctor that you talked to us about, who I believe is leaving at the end of the summer. My understanding that's because, at least in part, because of the use of telemedicine. Is that accurate? And what's your plan for, I guess, telemedicine and an eICU? Do you think that works for Natrona County?
So, Mr. Chairman, that's a very good question. It's an unfortunate question because Dr. Kathari is our medical director. Any discussions about what his future is, that's between us and him. And right now, he hasn't stated one way or the other. He is our medical director until otherwise notified, but he is really enjoying his job and is a great partner and is a great leader. Now, in terms of going forward, it's also important for you to know that Dr. Kathari is a huge advocate of eICU and telemedicine. And that's one of his frustrations, is that we haven't moved more towards eICU at night. And I am a staunch supporter that is not what I've heard from the community. And so we are looking at continue to have providers in the ICU. And so those are little things that you work out with your employees. And it's unfortunate that a private employment conversation has turned into a rumor that now has the county commissioners investigating the day-to-day operations and HR of a private business. We're going to continue to run an ICU. We're going to continue to staff it with providers. If we ever lose all of our doctors, Joint Commission and the state will shut us down. But that won't happen because we continue to bring in good doctors. Dr. Cathari continues to lead us, and we've got 2 great new doctors starting this year in our ICU.
You know, we're not putting our nose under your tent in terms of your HR problems. We're not causing that. This commission and previous county commissions, we can take the heat for a lot of things, but your staffing is not one of them. And so I think that, you know, any suggestion that we're investigating, you know, your HR issues, I think, no, we're asking you questions about things we're hearing from this community. And if we're hearing them, even if only half true, is still, in my estimation, a problem for Banner and its reputation. And we'll talk about that being a problem for the Collective Health Trust as well. You know, you told me in mid-February that you were trying to fill the pulmonologist position. You told me you have some solid candidates today. Why can't you get this position filled? And what are you doing about it? Because my understanding is, from people who know far more about that position than I and the services that person can provide, that it's a critical lacking piece for your hospital.
Mr. Chairman, you're absolutely correct. Pulmonology is a key need in this community. You know, we currently have 2 locums pulmonologists that are handling an outpatient, but we do need more support. That's not the answer for everything, and we need to move away from locums, as I've said repeatedly as we've gone here. And the fact that we've been able to reduce locums significantly in the last year. Pulmonology, recruitment physicians in general is not something that happens overnight. It takes a long time. Most of them are current jobs. And so you have to work through a contract process. They have to have their lawyers review it. They have to give notice to their current employees. A lot of time there's recruitment involves multiple site visits. And so you've got to coordinate with their current job and with what their current lifestyle is to get them out here. The 2 pulmonologists that we have, they have a site visit lined up in June. We have contracts in front of them already, and they've already said, we want to be there starting November. But we don't have a signed contract yet. And until the ink is on the paper, you don't go around advertising that because it would be unfair, you know. But it takes time, you know. It's months and sometimes years to get the right person. The other thing that makes it hard.
How do we get so many good doctors? Had great doctors in Casper, Wyoming. One of them sitting right back there. Really good guy, great doctor. We had great doctors without Banner. Never had any of these kind of problems. We didn't have people calling me at all hours of the day and night complaining about the hospital. People here understand that some people, you know, are sick and they may not make it. But we've had great doctors taking care of our people. And, you know, you come up with all of this stuff that just goes on and on and on, but there's nothing solid, I'm going to use the word solid, that I hear. Because it's like you're not hearing us, and maybe you don't care whether you hear us. I can understand that from a big corporation. They thrive on money, that's it. I understand that. It's money is the blood in their veins. It's green. It isn't red like the people. And our people are hurting, and they're scared, and they're upset, and I, as a commissioner, am not happy about it. And if I had the power to do it, I'd fire you.
Mr. Chairman,
Commissioner Millen?
so sometimes people's memories are a little short. I remember what a crap show Wyoming Medical Center was. And from start to beginning, people were complaining about that facility as well. Apparently nostalgia set in, though. I think we need to hear from Banner and not just start throwing accusations at him. My personal experience and other people's experience that I've talked to has been both good and bad. There's both sides. I can tell you one thing for certain, Banner's billing system is a whole hell of a lot better than Medical Center's ever was, and is better than Converse County's. I'm dealing with both of them right now. I'd like to hear what you're doing, objective. I know you have concerns, I have concerns, everybody has concerns, but just yelling at them isn't going to solve anything, and it doesn't provide any positive outcome. So I'd prefer, instead of throwing out the accusations and whatnot, let's hear from them. If we have objective problems, let's get objective solutions.
Appreciate what you're saying, but I'm throwing out truth of what people are telling me,
By who?
that I've seen it.
By
Do you
who?
want me to just say their names out here?
Gentlemen,
I have people talking to me in confidence, and I can tell you. Let me ask you about the guy who died up there that was 55. You brought in a local tenant, didn't sew the guy up, and he died. They told me that you fired that doctor. Do you know anything about that issue?
Mr. Chairman and Commissioners, yes, I'm very much aware of that, and that is a situation that
I'm good.
Banner
I'm gonna go
Health.
take a rest.
Can I answer your question? You allow me the courtesy to answer your question?
you can continue, Mr.
Okay.
Porter.
So this is a situation, and we spoke with the Concerned Citizens Group on this one as well. This is a situation where Banner Health stepped in and did the right thing. This was a cardiothoracic surgeon that had skirted any kind of responsibility for bad surgery. We did background checks. We did, put him through a very stringent pre-check before he was even brought here. We reported that bad behavior and his poor outcomes to the Department of Health. They are now pursuing legal action against him to make sure that he does not do cases elsewhere. The reason he ended up here is because other hospitals failed to take that action. They did not have the courage to report him to the Department of Health and the Board of Medicine. But we immediately did that. I've shown groups the subpoena from the Department of Medical Board. We had the courage to do that and make sure that he does not go out and hurt other people.
Thank you, Mr. Porter. What are the efforts to recruit endocrinologists, rheumatologists, and nephrologists?
So, Mr. Chairman, nephrology is fully hired. So this summer, Dr. Fargale will be started and will be fully hired.
What's the name?
Fargale. In terms of rheumatology and endocrinology, we are working with National Jewish on an opportunity to bring in endocrinologists and rheumatologists. Those two specialties are very difficult. I think we talk a lot about how Banner Health lost Dr. Johnson. But again, you don't remember previously that they recruited for many years to find Dr. Johnson. And another reason doctors leave, especially in these small subspecialties, is they're all by themselves. She was the only rheumatologist, and this community isn't big enough to have a large number of rheumatologists. One of the reasons, I'm not saying this is the only one, but one of the reasons she left is because she didn't want to be, she had no peer support. Another reason, her husband is an attorney, got a job on the West Coast. And she also had issues with the way Banner Health ran a clinic. Like I've talked about, it's change, total transparency there. But instead of recruiting another single practitioner as a rheumatologist, we're going to look at a really nationally recognized group who does this well. And
What's the timeline?
so,
Because a month ago, you mentioned, Dr. Cobb's raising his hand. A month ago, you told us about this possibility. What progress has there been, and what's the timeline to secure that relationship?
Mr. Chairman, can I turn this over to Dr. Cobb? He's leading this effort.
Sit down, Doctor.
I'm stretching. Mr. Commissioner, Commissioners, the follow-up is that I met with Steve Frankel, who's the CMO of National Jewish Health, 2 weeks ago, and we're exchanging a non-disclosure agreement so that we can share information about payer mix and the kind of things you need to do to make a healthcare deal work. They're very optimistic. We will be their first community where they do this kind of investment where you take, so it's even hard for them to recruit a rheumatologist, for example. And so working with us, we can extend a very difficult to recruit specialty that's best in the nation to Casper, Wyoming. So we're moving down that road. These are not fast. If we get this done by the end of the year, that will be fast in healthcare speed. And that's not Banner, that's just healthcare. Thank you.
So what do you do by the end of the year? That's like forever.
Yep.
So what do you do, or if you were king, what would you do to accelerate that so that it's not 8 months, it's 3?
It's a really hard question to answer, and the only way I can do it is by giving you some context.
Well, let me ask a couple questions specifically. Lawyers always slow things down. So you've exchanged an NDA. Can you make it a priority for your counsel to make it to push their counsel? Because you do control your attorneys in that respect, so you can prioritize that, right?
I wish that we controlled our attorneys.
Well, I understand with big corporations, sometimes the attorneys control more than they should. Are you doing your utmost to accelerate the relationship with National Jewish?
Yes, Steve and I have worked together for 15 years. We're close friends.
And what do you do if that fails?
So I think that the option would be to turn to another national organization. I think the likelihood of us recruiting a rheumatologist, a single practice rheumatologist to town, and it sustains for the next 10 years is exceptionally low. Rheumatology is such a rare specialty these days that people are waiting 6 months to get into their rheumatologist in Denver, where there's a decent concentration of them.
So-
It's a rough specialty these days.
So why not start the conversation with another national group for that and see which one moves down the road more quickly? And in fact, in my experience, it can create some incentive on, in this example, National Jewish, to accelerate on their end if they think it's a wise business move in the first place.
Yeah, I appreciate the advice.
Will you take it?
Sure.
Okay. Next time you come back, you can tell me who else you're working with, perhaps.
It'll be the Cleveland Clinic and the Mayo Clinic.
Great. Thank you. Other questions, Commissioner Friel? Did you have something? Commissioner North?
Mine's a little easier. Do you know what the percentage of traveling nurses versus residents are that you have right now?
So actual percentage, I couldn't tell you, but we're down to 35. January of 2023, we were at a little over 100 traveling nurses. And so we've been very successful in driving that down, hiring nurses that live here, work here in Casper. And so, yes, so we've significantly reduced that.
Okay, thank you.
I don't think we have any other questions for you, Mr. Porter, but please stick around. And we're going to spend a few minutes visiting with Ms. Worthen and her team. I think you've heard that the commission does have questions and does have concerns. I think that the commission understands these things can't be turned around overnight. But you've been with Banner a long time, and you've been here in Casper for quite a while. And Banner has been operating that hospital for quite a while now. We're through COVID. I think there's an expectation that we're going to see more progress, if not immediately, then very soon. And I hope that you understand that we all want the best for healthcare in Natrona County. But I think you're kind of the tip of the spear in making healthcare better. So please continue in earnest the efforts. Anything else for Mr. Porter right now? Ms. Worthen, what do you believe the role is for the Collective Health Trust in oversight of Banner Wyoming Medical Center? I know that Ms. Oden, your board chair, and I believe you too, have used the phrase fiduciary duty or as fiduciaries. So help us understand what role you have. As I look at your website here in front of me, and as I look at your 2023 annual report, I see almost nothing that indicates there's a duty or engagement with the Wyoming Medical Center Banner folks, other than there's funding of the, 3 or 3.5%. So let's go back to what is your fiduciary duty, or um, how do you oversee Wyoming Medical Center operated by Banner?
Mr. Chairman, happy to answer that question. So per the Foundation County Agreement, which is something that we take extraordinarily seriously, our purpose as a foundation is to support the delivery and accessibility of high-quality healthcare services throughout Natrona County, and the overall physical and mental health and well-being of Natrona County residents. That's something that we really do take seriously. We do monitor Banner's commitments made during the transaction, and that's something that we report on each year. It's not just something that we do once a year. It's something that is consistent. We meet with community groups. We meet with Banner Wyoming Medical Center. We talk with providers throughout the community. We also, as you mentioned, Mr. Chairman, do provide 3.33% of the foundation's net assets. That actually, in our budget, translates into nearly 60% of our annual budget that we distribute to Banner Wyoming Medical Center. They have flexibility with how they use those funds according to several different buckets, and then they report that use to us, and we in turn report it to you. So I think that it really is both that distribution of the funds, but also those ongoing conversations that we have with members of the community and with Banner Wyoming Medical Center. We also do our own independent research. So for example, Commissioner Friel noted concerns with regard to quality and patient safety. According to the transaction obligations, they report information to us, but their metrics need to be comparable to comparable Banner hospitals in the Western region. And so we take a look at that data, we analyze that data, we analyze the financial data that they give us. So it's something that happens throughout the year with a number of steps.
So who's the person employed by the collective to manage those, the relationship, and I guess you use the word to monitor. Who is that with the collective that does that?
Mr. Chairman, members of the commission, we don't have one person. It's something that I, as CEO, take seriously and answer to. It's something that our Vice President of Operations participates in compiling the annual report and doing other things. It's something that our Vice President of Finance does analysis in and does research in. So it's something that we as a team do. And I'll also say that members of our board participate in this as well. You've been in meetings, Mr. Chairman, with members of our board
Just one.
and members of the community and myself. That's something that our board also spends a great deal of time on.
Well, I'm concerned about that statement because in our previous visits in front of this board during my tenure, I really haven't heard anything about there being monitoring of Wyoming Medical Center by the collective. I've heard that there's some review of the request, I call it the Christmas wish list of Banner that's funded the $9 million or $10 million, and I know that's growing. But in terms of the quality of care Banner's providing, that's never been a focus, to my recollection, at your presentations. And so why, or would you be open to having a full-time employee be devoted to monitoring the services provided and what's going on at Wyoming Medical Center?
Mr. Chairman, I'd be open to doing what our purpose is, and that is to support the delivery and accessibility of healthcare services and the overall physical and mental health and well-being of the residents. If that's something that our board determines that is needed in terms of a full-time employee, compliance officer or what have you, that's something that we would do.
So it's something I'd like to see, and it's something I'd like you to discuss with your board, to have someone dedicated to that. I think that there can be written reports from Banner to this individual that hopefully has some background in the area, because I don't think a lot of your board members do. And I know you in particular and your vice president of operations have a whole lot of other things that you need to do to manage the $290 million, 300, is that what it is roughly?
Roughly, yes.
And so, you know, you agree with me, I hope, that what Wyoming Medical Center is doing is probably the largest impact on healthcare and the quality of healthcare in Natrona County.
Mr. Chairman, I would agree with that. And as I mentioned, nearly 60% of our budget goes to Banner Wyoming Medical Center each year. And it's certainly something that I will have our board discuss in terms of an employee for compliance.
Are there other questions or any questions for Ms. Worthen?
I just have a comment. I think you're doing a good job. You have a great board. You got a great new member back there. I see her sitting there. And I agree with exactly what our chairman said, because it's in all my years of living in Wyoming, which is all my years, I've never seen more of an uproar than this one and one other one that has to do with Casper Mountain. It all has to happen when I'm on the commission. So whatever you can do, we'd sure appreciate it.
Thank you, Commissioner Laird.
Ms. Worthing, I just have a few questions. So 60% of your budget, if you're talking 2023, was that contribution the 8,066,244?
Mr. Chairman, Commissioner Friel, so in this year's budget, that was 2024 figures that I provided, or that I said to Chairman Nicolason. So we're at about 57%. We go between, it's 3.3% of our net assets as of 12/31 of the previous year. And so that really, there's a range of about 56 to about 59%. Can certainly provide you any year that you want.
Okay, but that's a requirement that you have to give that money to them, correct?
Correct.
Okay, and then of the other 40%, how much do you put out annually in wages?
Mr. Chairman, Commissioner Friel, I would have to do a deeper dive into the percentages. I know that our operations, we kind of separate our budget into buckets, such as our distribution to Banner Wyoming Medical Center, our grants, our programs, operating Masterson Place there near the hospital, and then our operations. I want to say our operations are at about somewhere between 11 and 15%, but I can get you the specifics on that. I just
Okay,
don't have it in front of me, Commissioner Friel.
I guess let me ask a little different. Let me ask it a different way. How many employees do you have?
Mr. Chairman, Commissioner Friel, we have 8 employees at the Health Trust, an additional 3 at Masterson Place, for a total of 11.
Okay. And then I would be interested in what those employees, that's what I'm talking about as far as wages go, what those employees make on an annual basis. And then last question I have, did you just recently two questions. So what do you put out normally in grants per year outside, not counting what you're required to give to Wyoming Medical Center, but what's an average that you put out in grants?
Mr. Chairman, Commissioner Friel, it runs now at about nearly $4 million a year.
Okay.
We have a total budget, Commissioner Friel, of about $15 million at this time.
All right. And then the last question that I have, is, did you recently purchase a building itself? Or can you disclose what you paid for that?
Mr. Chairman, Commissioner Friel, that's something I'd have to obviously consult with my board about.
Okay. So,
Ms. Worthen, when you say that the collective trust, and you in particular with your Vice President of Operations, monitors the performance of Wyoming Medical Center operated by Banner, do you have any conclusions about the quality of care they're providing?
Mr. Chairman, I would say that that is something that is just always on our radar in terms of discussions. There are times we have discussions with our attorneys related to quality of care and how it relates to the transaction obligations. And so it's ongoing.
So you have, over the time that you've been monitoring the performance of Banner, you've made no conclusions that you can disclose to the public. Is that what you're saying?
Mr. Chairman, I would say that the conclusions would be the full spectrum that we've heard today in terms of satisfaction with, being impressed by, and being concerned with. There's a full spectrum.
Have you provided those conclusions in writing to Banner?
Mr. Chairman, Banner receives the report that we provide to you. I don't know of conclusions that we would provide to them at this time.
What about recommendations to improve the quality of care they provide? Have you made any of those? Has the collective made any of those since the sale of the hospital?
Mr. Chairman, we have ongoing conversations with them. We haven't provided anything to them in writing.
Wouldn't that be a good idea to provide those things in writing so that there's documentation for posterity at least, that people don't have to reinvent the wheel if recommendations are made?
Mr. Chairman, that's certainly something that the board could take a look at, and my chairman happens to be here right now.
Perfect.
Mr. Chairman, Commissioners, I just want to comment, one on, Chairman, your suggestion of hiring an employee specifically to oversee, monitor, make sure Banner is fulfilling their contractual obligations. There's actually other avenues that we're researching as well that maybe would not need to have a full-time employee to do such. There are other private health conversion foundations that use other means to do this. In light of, I would say, what's happened over the past year or so, we're exploring all of those options. So there are other things that we've learned from other private health conversion foundations, so.
Well, consultants can be more expensive than full-time employees at time. And I would suggest that you be open to the possibility of hiring someone that's dedicated to your organization for the long term, that can have basically, I guess, provide information to your board and to your director, and so you can make decisions. So it's not just a one-off kind of thing. At this point in time, our consultant says this. Your organization's hired consultants, we've hired consultants, they have a place. And in fact, I think one thing that you ought to consider, and that this, and I think I've talked to some of you before, is consider a facilitator that is jointly hired by Wyoming Medical Center and your organization, that can do an assessment at a particular time, and maybe, I don't know when that study or that analysis can be done, but if you have an outside consultant that, and I think this commission should be involved in or have a say in who that's going to be, so that everybody feels comfortable with their skills and with knowing that they're going to be impartial. They're not going to be Banner's guy our guy or your guy, but a facilitator to say, okay, objectively, here's where quality of care was at the time of the sale. Here's where it is now, and these are the 10 things we need to do moving forward into the future. So I think there are really two things. I think one is, I feel you guys need an employee that can be not dedicated to grants, not dedicated to training and providing capacity or building capacity with organizations. I know that's a focus of yours, and I don't have a problem with that, but somebody that can be your Wyoming Medical Center person, but then at the same time have an outside consultant that we can all trust, that they can ask the right questions and that can report to this community so that we can continue to make some progress, continue to move in the right direction.
Mr. Commissioner, thank you. Mr. Chair, thank you.
Anything else for these ladies? Thank you for your time today. Thank you. Yep. Thank you, Mr. Porter, Dr. Cobb. Now we're going to speak to the Memorial Hospital Board of Trustees. Did you have anything that you'd like to say or make comment on? We can set up a meeting with you guys in the near future. Thank you very much. Our next appointment is I have an old agenda. I believe it's Youth Crisis Center. I printed off one from last week. Thank you. Yeah, Youth Crisis Center, Mr. Holsheiser and Mr. Lathrop. Thank you for joining us.
Commissioners. With me, I also have Lisa Shoup. She's our Finance Director and Employee Resources Director.
Brains.
She's the brains of the operation.
Yeah.
Very good.
For sure.
Thank you.
So, well, thank you. That's going to be a tough one to follow. It was interesting. I was actually with the hospital when they went through the transition. So when it was over, I actually was able to have an opportunity to work for these guys. So I took that opportunity. And
You were with security and they had no issues all the time you were there.
no, they had one, and then that changed the whole dynamic pretty quickly. And rather interesting. I was over there the other day, and all that stuff that we put in is gone. There's no metal detector or anything in there. So crazy. There's no metal that we put all that stuff in the entrance there to the ER. And now all that's gone. But well,
Hey, go ahead.
no, go ahead, Gary.
Thanks for having us, commissioners. We appreciate your support at the Youth Crisis Center, your ongoing support over the years for our kids in crisis, and the county has certainly done their part. And more recently, you recall, we were here because the judges had been sentencing youth to the crisis center, and we had no funding. We were having to go that alone, and you folks, stepped up, and you funded the bridge program, which we're here to talk about today. Bridge program has been extremely successful. We believe that it's kept a lot of kids out of jail. We believe that for those kids that can fit that program, it's more appropriate than jail. We find that those kids actually get a chance to go to school, get a chance to be out in the community and in the milieu instead of being in the system. And for that, we appreciate you. We're here because that's a one-year program, and we want to convey our extreme success and tell you about it. So Dave, if you wanted to to describe how successful that's been, I'd turn
Sure.
it over to you.
I have that as part of my presentation if I can, Chairman, Commissioners. So again, this is a little bit of the PowerPoint that we had last year, but I've gone ahead and changed a few things. So current operations at the Youth Crisis Center, our Youth Crisis Shelter Wing houses up to 10 kids. Those are more for the temporary emergency needs where you have a parent that has a child out of control, or you have a concern that DFS needs to get someone into right away, immediate housing needs. I believe with Commissioner Milne not here, that several of us law enforcement would use the Youth Crisis Center when you came across like a protective custody situation, things like that. So that is, we are busy. We are busy continually throughout the year. Right now, sitting at our facility, they're actually at, several of them are at school now, but when they're there at night, we've got, I think, 9 currently right now. Our group home wing, which is our long-term program, which we do receive funding through the DFS contract with them. Again, it doesn't pay all of the amounts for that, but we are able to utilize additional funding that we get, private funding as well. That actually houses up to 5 kids in that long-term program. And we're talking 6 to 9 month programming for these kids. They learn everything from different life skills to we keep them in school, get them back on track. They work through a strength-based approach program, which is really helping them continue to build the foundation of their life and continue to get better and better as they go. This court-ordered youth program, which is the bridge program we talked about, this was the additional funding that you all last year provided to us, and I want to give you a sincere, heartfelt thank you for that. That $118,000 that you provided to us went a long ways. And I want to show that in the numbers. You allowed us to, in turn, leverage the DFS money that they provide because they were able to cover a lot of those costs. We just needed the additional staffing to meet ratio staffing. And that money was able to help us open up those 5 additional beds, which helps you keep kids out of the detention center. And there are some things fluctuating, I think, at the detention center in terms of numbers of how many they can take and how many they can't. And when that happens, a lot of times they'll come to us as the ulterior or the other entity that can take those kiddos because of the 24-hour supervision, the housing, the beds, the programming, and so forth.
And your good food and your big refrigerator.
Yeah, and full transparency, we did a fundraiser this year, got enough for a freezer, so we're gonna have a walk-in freezer as well. So tell all your friends at the livestock auction, we're looking for lots of cows and lots of pigs. So, because we do that, these kids eat a lot.
How about elk?
We can't have that because we're a licensed commercial kitchen. So unless we buy it from a commercial distributor, we can't because we're licensed through the Department of Health. Unless you guys want to change that somehow. So, but what I will tell you is that the food program is a foundational program for us because a lot of kids face food insecurity. It is a real thing. I think 3, 4, 5 of you on the committee have probably seen it firsthand of food insecurity with kids in a home. It's real and it affects them. So one of the foundations for our program is make sure that they get good food and that we feed them well. And that's the last thing on their mind when they come to us. So the 10 unused clinical wing beds, I want to talk a little bit about that in a partnership that we're looking with CWCC that will directly help our community. And I'll kind of go into that a little bit more. But again, just an overview of our building, crisis wing, the group home, our administrative offices, and this, I don't know if it'll shine on there, that's the unused wing currently. Our new walk-in freezer will actually be going at the top right parking lot where the red car's at. We'll be tucking it in right there next to the kitchen. And that has been ordered or will be ordered tomorrow so we can get that going. So we're excited about having that. Current model for at-risk youth programs that you'll see from us is that in 1984, we really looked at the juvenile justice model as our way of doing business. And that was an acceptable model and a good model for many years. But in the last 5 years, we've moved away from that model because it has shown to be not as helpful as a clinical substance abuse type model that allows us to address some of these issues that these kids are seeing. At the base, when we get a kid into the Youth Crisis Center, there's a very good chance that either they have a mental health concern or they have a substance abuse concern, but oftentimes those are overlapping. So they have some concerns in terms of their mental health and their substance abuse. And we'll also tell you that is something that faces the parents as well. So it can be a struggle for these kids. In June 2021, we made the change to fully clinical model, shedding any of the juvenile justice model, which is the rigid, more penal type institution of hardcore rules, no talking, controlling movement, things like that, to more of a therapeutic environment where we're working with them on life skills and important things that they're going to need after they get to that adult age. Currently working on a clinical director. We have one full-time lead therapist, two case managers, two full-time case managers. And we're always looking to put on more therapists if the need calls for it. And right now our therapist is maxed out on our hours, so we may be looking to add an additional therapist. So our crisis wing budget, last year, the Natrona County Commissioners provided us $50,000 for the crisis wing budget. That would be the allocation that we would request again for this year, just a continuation. But what it shows is that the Natrona County Sheriff's Office brought us 18 total juvenile placements, just the officers themselves. Now, the community placements are around 60. Those are not officer brought to us. So like parents that have brought those kiddos to us for that emergency relief. So if you're looking at the average length of stay, we have been going up steadily. So last year was about 9.5. Now we're almost at 11 days. We're at 10.86 days. So if you take the cost of doing business in the crisis wing, which is our lowest cost of services, the cost of the county is around $193,000. You guys provide 50, we fundraise for the rest of it, and we very much appreciate what you guys have done with that. I'm just giving you a comparison of how we're able to leverage private funding and state contracting to help the needs of the community at the same time. And I do want to say this about the Natrona County Commission. You guys have stepped up to support YCC in a big way compared to other counties across Wyoming. And I want to tell you that you guys are, I think, the model going forward of how county commissioners can really have a positive influence on the youth in our community through programs like this. So I want to thank you guys for that. I really do. You guys did a really good thing last year and many years for supporting us. So our court-ordered youth program is what Gary was talking about. This was the allocation last year that you provided us, the $118,625. Again, that houses both district and circuit courts from Natrona County. A lot of times these kids are with us between 10 days, 30 days, but we're seeing kids even longer than 90 days on these programs. The reason for that is that we're trying to get, most of these kids are either waiting to go to another facility for treatment, or they could possibly be waiting to go into either the girls' school or the boys' school. So that is where this program isn't ideal for a group home program, because the group home program, they graduate out of the program. These kids need something in between jail and their next step, which is either a residential treatment center, a qualified psychiatric treatment facility, like down in Torrington with St. Joe's, or Teton Youth and Family Services. Red Top has one. So this is that program where we catch several of those kids that just don't need to be in jail, but can be here at the Youth Crisis Center. And this is what you guys are able to provide to us this way. So what I wanted to point out is that we've done program tracking in the last year. Hard true numbers up to March of from July 23 to March 24, we housed a total of 74 court-ordered youth with a total of 912 days of housing. When we take that and put it into projections from July 1 to June 30th, we'll be looking to have housed a total of 98 youth for a total of 1,216 days of housing and services provided. So with the funding that you have been able to provide, the $118,000, the actual cost per day per youth is $97. So that amount of money that you have provided allows us $97 a day per kid to leverage the rest of the money from the state in order to make this program successful. And this program is for the Natrona County kids and Natrona County court kids. This is what we use this program for. That was the allocation, was for our district and circuit courts. So if you look at the cost per day, the $97.55 a day it's a pretty good deal for housing, shelter, programming, getting kids to school, teaching them life skills, getting them into therapy, all of those things. So there was a lot of use of that money, and we appreciate that. So when we look at our request for fiscal year 24-25, we're just asking for the continuation of what the commission did last year. We're not asking for any increases. We'd be looking for the potential of the 168,625, and that covers both the crisis program and the court-ordered youth bridge program that we have in place to help with the kids coming from circuit and district court that are waiting to go to other placements. So that would be the request. But I want to talk a little bit about how we're growing at YCC, and I'll kind of share. I want Gary to talk a little bit about our 40th year celebration, because this is actually, we've been here for 40 years. That's a pretty significant time period for a youth organization to be in a community doing what we do. So.
Right, and the Youth Crisis Center program was a dream of Dick Grisang, Kathleen Henry from the high school, and the Episcopal Church, and many community members back in 83. I didn't come on the board until 88, but I'm privy to the information that they started out on South Jackson Street in a single abode, and many of us, they helped many of our kids that were going through it at that time, and for some day or sometimes many trips. But then right at the end of the 80s, we built that crisis shelter up on McKinley Street across from Washington Park, and that served us for many years, along with Mrs. Henry's home, which she had given us over on Beach Street, and then the R.M. Nichols home in North Casper, and which was donated by a supporter to the Crisis Center. Well, we it was really difficult sledding through the 90s and in the early 2000s, because we were running 3 kitchens, 3 cooks, 3 supervisors, and all of those things that come about with 3 facilities. So thank you for giving me this little bit of time. We did embark in 2010 to build our current facility, and that encompasses all 3 with 1 kitchen, and still able to have a license for 20 beds, and to have a license for a 10-bed crisis shelter. And so that brings us to the present time. We're on our 4th capable director, Dave, who is actually an experienced detective, retired from the police force here, and has done a very nice job. We've been very successful in raising some money for the mental health, and we've been Dave's been very effective in some grant writing, which has kept us going. In addition to the state's money and the county and the city's money has been great, but it hadn't covered the full cost, since we have to have a person for every 6 kids, plus a supervisor, and that's by statute and by law, that we got to have that many people for each. And so it's hadn't been without its difficulties, but I'll just share with you that for 40 years, the Youth Crisis Center has ably helped this community. We're going to have a 40th anniversary and award celebration this fall, and of course we will be we'll be recognizing some of those people that have helped us along the way, and you'll all be invited, and as well the others that have helped, and I'm sure it'll be a quite a interesting and fun evening with low-key, very little fundraising effort. We're going to outline our program for the future to the community, because we do have plans to continue and to continue to grow. And this program that we're outlining over the next year is a pretty ambitious program when you consider that we're going in with the Central Wyoming Counseling Center and finding a place for these kids that right now don't have a place. And Dave will be sharing that with you, but we're pretty darn proud, number one, and we're pretty excited that that we've made it this far, and that we're gonna have this celebration and continue on into the future. Thank you for your help with this program. It's actually a model for the state, and it's a successful model to keep kids out of jail and keep kids safe. And and you all know I love to talk, but when you deal with these kids that some of them are beat up, some of them just have no place to go because they're abandoned, some of them, their parents have been killed or injured. But people need a place to go, even in a good family, when catastrophe happens, but let alone the child abuse and the drugs and the rampant things that we have here. So Dave will outline a little bit what we have going forward, and we'll be sharing it with you as we go along this year. And again, thanks for your help.
All right, well, thank you for that, Gary, very much. So we were able to receive a grant for some rebranding and new website development. So in the next year, we're trying to put all this together with our 40th year anniversary coming in October. So from us, you're going to be seeing a brand new website, but that website's going to kind of revise and update current mission, vision statements, core values to align more with the services that we're providing now in the clinical modeling versus more the juvenile justice modeling. So we really wanted to update all of that. We're looking to redesign our logo. We're not renaming. Everything's going to be staying the same in terms of the name, but we need to bring a new perspective to our website, and we need to make the website more available to parents and kids in particular. So you're going to see more QR coding. You're going to be seeing things like that to put it in the schools. So like if a kid doesn't know where to go help, if they're homeless or they're having problems at home, we'd love them to hit that QR code with their phone and lead them right to our website to where we can get them help, or we can refer them to other help as well. So I think that resource is going to be huge, and that actual grant came from the Natrona Collective Health Trust as a one-time grant, staff recommended grant for us. So we're excited about that. We've also been able to set aside some funding for strategic planning efforts. We have not had a strategic plan ever at the Youth Crisis Center. Outside of building the building and the fundraising of the building, this strategic plan is going to be more of where do we go, what do we need to be doing, and how can we grow in the next 3 to 5 years. When that plan, certainly we'll put out some information to the commission so that you guys have some input on that as well. But we would love to get your ideas as to where we go 3 to 5 years. We know that we probably have to grow clinically in terms of therapy, counseling, maybe occupational therapy, things like that. So we're excited about that. Those two programs or those two projects that we're working on, hope to have those done by the time we have our 40th, so we can unveil all of that. And that work is currently undergoing right now. We are using both Casper companies for those. So those are actually Casper centered companies that are here doing that. The next exciting thing I think is this, and this I'd love to get more discussion on, is the Central Wyoming Counseling Center and the YCC partnership. What we're finding is that in the state of Wyoming, that there are residential treatment centers across Wyoming, but due to staffing, due to funding, things like that, they're not able to get kids in right away. So a lot of times our kids will sit for a month, maybe 2 months before they can get sent to a treatment center. There is some, and I believe the next slide is that, our unused wing. There is some I wouldn't say concerns. There's some difficulties with the State Department of Family Services with us being provided funding by them, because the model that we're looking at is different than what they want to, and different than what they're providing. Plus, they don't have the funding to take on another residential treatment center. So what we're looking to do is a 1 to 2 year pilot program with CWCC that does what's called an unbundled RTC, which allows us to go to the school district and have the school district help us with the teaching component of it. And then CWCC does the intensive outpatient treatment, which is like a 3-hour program throughout the day. We handle the housing, we handle the food, the transportation, the supervision. And the idea, this actually was a great idea from Jim Cowser, the new our CEO of CWCC. They do it in Florida, and it's called an unbundled RTC, to where you take advantage of your organization's strengths while using another organization's strengths, and you make that partnership. And I know from my times in law enforcement that partnerships work. We work well in the community. Nonprofits in Casper, I think, work very well together. And I think that this is a good way to begin to look at how does communities with all these resources put these things together to become a partner in order to best provide for the youth in the future. I mean, I think partnerships are critical, because in order to do an RTC in the form that DFS wants it, every program has to be done inside your facility at one location. You have to hire a teacher, you have to hire the clinical staff, you have to hire the housing. All that has to be done in one location. And it can't be attached to your crisis or your group home wing, so it'd have to be a separate facility. That's their model, so we wouldn't qualify under those rules. However, with an unbundled RTC, we qualify under the group home rules, because we are transporting kids to the school district to do schooling with, say, the REACH program for the school district, which is a special program with kids that have some mental and substance abuse concerns in a classroom of their own environment. And then being able to transport those kids up to CWCC to do their treatment, everything is in place. What we're currently working on is that financial component. It's for the yearly staff, because of the ratios, it's going to be about $300,000, and we're working to free up some of our funding and find other private funding to help us with that. In addition to that, I believe the state, Jim Cowser has been talking with state legislators. There's some ARPA funding that they've been able to release and potentially repurpose into a pilot program. But we want to show that this method of partnership can be highly successful. And we don't have we have a quasi RTC. It's more of a psychiatric treatment facility at WBI, but they're limited in the number of kids that they can take. This would allow us to take anywhere from 7 to 10 kids in that program, without having to send them to Jackson, to Laramie, to out of state, to Torrington. We could keep our kids here locally, at the same time helping keep the family as part of this process as well, because that's another huge concern is getting families in the mix. So I want to come back to this slide as kind of the last one, but what I want to show you is last year I presented the information for 2022. Wyoming Youth Services Association is our group that we're part of that actually lobbies on our behalf at the state level with our legislator. So this is a one-day snapshot of all the kids in congregate care in the residential treatment or group home care of several of the large WISA agencies. This data was pretty troubling to me. When you look at 85% of the kids in congregate care have a mental health diagnosis, one or more had failed prior placements, or 37 had one or more failed prior placements. 28% had attempted suicide or planned to attempt suicide. 75%, again, these numbers are up from the year before, suffered some form of abuse. 33% suffered some type of sexual abuse. I mean, that's 1 out of 3 kids. That's a lot. 45 had a history of personal substance abuse. That number is staggering, and I believe we're seeing that reflecting at much younger age groups. Mm-hmm. We're seeing fentanyl creep in at younger age groups, it being laced with pills and marijuana and things like that. And that can be very harmful. That can be very detrimental to kids. 63% came from families with substance abuse problems. 33% of came from families where one or more parent had been in jail for an extended period of time. And then this last one stayed consistent with the year prior, but still it's pretty high. 3 out of 4 kids are prescribed some type of psychotropic medication. And that is part of what we do. We don't have nursing on staff, but we follow. We do provide them with their prescriptions according to the prescriptions, and we do track all that. So the kids get full care when they're with us. If they need to go to the hospital, we take them to the hospital, we take them to their appointments, all that. That's all part of our services that we do for these kids. We ensure that they're getting their needs met.
Excuse me, is there a particular medication they're given?
I'm not, I can't tell you 100%, but I would imagine it is medication for anxiety, depression, could be even other things for like bipolar disorders, things like that. I think it's a whole broad spectrum that you would anticipate seeing within a community of even adults. So, but you know, the current discussion, kind of wanted to go back to this just a little bit, but the last 2 months, I think we've seen some pretty significant youth on youth violence in our community, including the homicides that have happened in the last year. I think that's a big topic that now everyone in our community is like ramped up and ready to go. And you see this as a trend that everyone gets ramped up and let's address this and let's fix it. And there's a lot of us out here, and I think Youth Crisis Center is a great example. We've been here for 40 years. We've seen those cycles. You know, as we look at the state legislators, they're reluctant to increase some of the funding for some of these programs until local community governments begin to pay more for these programs. And that's where I want to throw the plug back to you guys, that you guys stepped up. You guys did a tremendous job. And I think you guys are a model forward for the state to show, you know what, we care, and we're putting funding to this. Because everyone will tell you that there's all these great programs out here that we can do this and we can try this and we can do this. But the thing that a lot of people don't talk about is that it takes money to do that for an organization to actually do that. And I think that's a big part of it. The state of Wyoming is placing a much stronger emphasis on mental health, substance use, and behavioral health concerns. But the messaging that we got out of that was yeah, we're going to invest in that. We're going to redesign the model, but we don't want to throw more funding at the issue. They want to see where it goes. And those are, I think, long-term or discussions to be had more on the politics end of it. But what I can tell you is from the actual service end of it, nonprofits in Wyoming, and specifically speaking about Natrona County, your nonprofits that are in your community are your backbone of your human services and your social services organizations. Outside of DFS, which handles kiddos and some elderly abuse cases, Mercer Family Resources, the CAP Center, the Youth Crisis Center, the Hope House, so many of those foundations and nonprofits are the backbone of the youth services of the community. And I can tell you this with a surety, the funding that is provided to a nonprofit goes a lot farther than the funding that you would provide to a governmental entity. I can 100% tell you that. We have accountability on all levels of our organization. We have audited financials yearly. We have an oversight. We have a board of directors that goes over our financials every month to ensure that we're spending our money wisely. Our policies have to be in place in order to carry our insurance, which our insurance was canceled this year and we had to find new insurance, which was a struggle for about it was a struggle.
Mr. Hilsheiser,
Yeah.
we're out of time.
Sorry.
I think we have a couple questions. Commissioner Friel?
Real quick question. You have down 18 total juvenile placements from NCSO.
Yeah.
And then, so you had 60 from the community itself. Do you not have the number? I mean, do you know what numbers are from CPD, Evansville?
Yeah,
Mills?
those are just ones that lied outside in the community. We did not include Mills, Evansville, any of those, but I do have those and can share those.
Okay.
Yeah, we're upwards of, you know, for the total kids that we see per year is roughly 600 kids per year that we're seeing.
500
And
to 700.
the majority of those do come from the city of Casper. Yeah, and not only the PD part of it, but also the community itself bringing kids to us. The majority come from Casper, they do.
So you have 500 to 700 in the facility a year?
Yeah,
And so between community and parent placement, it's 60, and then NCSO, that's 80. 420 are coming from other law enforcement.
Yeah, we do see some that come from other jurisdictions as well when they do move kids through with DFS. When we do work within that network of WISA, so when there's kids that are having a hard time in other shelters that don't have the experience that we do, we'll sometimes take those kids on to help DFS. DFS is in a real pinch when it comes to seeing the number of kids that they do. They see a lot of kids, and it's not easy for them to find placement for every kid. Their numbers are about 20 to 30 kids that are just inappropriate for any of the WISA programs that they're really trying to find placement for, that become too assaultive, the behavior is too difficult for us to handle. But even with that, we try to do our best to take that early stages of those kids before they can't be at our facility for the safety of our staff, so forth.
That under,
Commissioner Laird. Oh, Miss, did you have something to add
no,
to
I
that?
just, did that answer your question?
Yeah, it did. Thank you.
Gary, thanks for your many years of service.
Sure.
I appreciate it. I knew you when you were young. And, I mean that. And, David, thank you for your passion to help children. I forgot one thing, and that is how much it would cost to open that one wing of the 10 beds. What would that cost?
So we would take the funding that we have and leverage it with food and all of that. It's really the staffing. We need a full-time set of staff and a case manager to open that. So we'd be looking anywhere from 300 to 350,000 to open that additional wing
Per year?
per year. But you can see, we have 10 beds in that facility, and that would open up 10 RTC beds for our community and would allow us to work with CWCC. They've committed to doing all of the clinical and overseeing all the clinical, including the focused intensive outpatient treatment is really what it is that these kids need. And that's a 3 to 4 hour deal every day that they go to. They have the facility for it in terms of meeting space. In order to handle that, they can hire the therapists and the staff to do that. What's the hardest part is the housing and the licensing through DFS. And we already have that licensing because this program would fall under a group home licensing and not the RTC licensing. So it's kind of a win-win because we take advantage of the space that we have that's unused. And as we talk about all of the mental health things and this behavioral health, at this whole point, the state's had the discussion. I've never had anyone from the state call and ask, hey, how many additional beds could you use? Do you have unfunded beds? I hear them talking about potentially building other facilities, but throughout the state, there's lots of organizations that have that have bed availability and have the availability to put those to use. The funding just isn't there.
Well, if it saved one kid from being stabbed or shot, I'd be for paying you the money.
Yeah, and please, that's not a
I
proposal
know.
that we've put forward. We know that it's gonna be a pilot program for 1 to 2 years. We wanna show that it can be successful. And Jim Cowser and I are working through some of the particulars on that. And we do know, I think it is Representative Larson. He's been in contact with him in regards to some of that ARPA money that's been reallocated this year. So we're gonna see if we can tap into some of that, but certainly the support, I think, would be very much appreciated.
Our plan, which will be coming by the time of our 40th anniversary in the fall, will not be a plan that's all on one entity. Dave has shown an amazing ability to raise funds to help with this, and he's done so for the crisis center and for the therapists. But hopefully between the DARPA money and between money from the local entities and between the money that we can raise privately, we'll have a cogent plan to get this pilot going, because the kids are out there. Believe me, the kids, 166 kids on one day in that snapshot. Well, we see 700, and we're not the only place in the state. We already see a lot of these kids that we're talking about that need this help, but we see them in a transitory setting where they're in the crisis wing. Well, then eventually they go out of state for treatment. They come back and they try to put them in home, and that doesn't necessarily work right away. Or they need to go to treatment and they can't necessarily find a place right away. So this is a program that will dovetail right in with some of what's already existing. And in our mind, it will not fall all on the county. It will fall on the crisis center, it'll fall on our donors, and it'll fall on the state. So.
Because we want to make it successful. And I did want to add one extra thing when talking about the kids' situation. I think one of the difficulties with kids nowadays is that in order for them to see the full help of DFS and some of these other state resources, they almost have to get in trouble with the law to see that help. Does that make sense? Like, they have to get into the court system to be part of that financial system. One thing that I don't think we're talking enough about is the parenting aspect of it and how to hold parents more accountable. And this would be more for a county, a city, state legislators to think about, but maybe there's a need in our state and our counties to think about family courts to where we can hold, before it gets to the point where a kid gets in trouble, a parent can be held responsible for the things that the kids aren't doing. I think that lends itself to should lend itself to some real discussions as to,
The first time I ever ran for election, I proposed that the juveniles that get arrested, the parents should serve the night in jail with them. I got beat like a drum. People don't want that.
there are models out there in other states that are successful. So, I mean,
I'd like you to send to our clerk and to our administrative assistant, Michelle, your current year's budget and your coming year's budget for this coming year. Could you do that?
yeah. Do you want it to reflect the request or without the request?
It can reflect the request.
Okay, we'll do some
You
current balance
mentioned,
sheets. Do you want audited financials? I could send those as well.
I think just your budget.
Okay.
Yep. What does the city of Casper contribute to you annually?
So it was an interesting year last year when they did the changeover with the 1 cent fund. They used to do it every 4 years. Now it's so like if you get the 4 years, you get 5 years of funding. So last year we got 19,000. This year we're set to get 69,000 from them. And there was a mix up when it came to the grant cycle last year. We submitted for an increase of 100,000 per year. Somehow that got confused on their application process. So we resubmitted and sent them a letter. They re-upped their commitment from 1 cent fund 16. I think we're on 1 cent fund 17. I can't remember the number that we're on, but we were able to go back. They brought us back to the funding that they did the prior 4 years, but because of how they're doing it, they have to earn the money first before they give it all out. So they're giving, this year we got 19. This coming year we'll get 69, and it'll be that way for 3 years, and then it'll be another small amount along with the remainder amount for that 4 years. It's kind of hard to explain. It was how they kind of explained it to us.
Historically, another way to put it is historically, they had contributed 35,000 a year, if my memory serves me
Yeah, that was
correctly.
before my time.
And they've changed that program so that as they get it, the organizations get it, and we had put in for an increase. So I think it'll be more than that this year.
No, it'll still be the 69.
No, but I mean more than that 35 a year, just it comes in different.
Yeah. One thing that we've been.
Let me say we're well over.
Okay.
Let me ask a couple more questions though. Are you getting anything from the city of Mills or the other the towns?
So Evansville provided us with $2,000 this year. I did meet with them last year during their work sessions, proposed $20,000. I put in a request for $20,000. That Mills did not do that for us, and then Evansville brought that down to 2,000. But Evansville did put in funding last year.
Mills is at 0 and Bar None is at?
Bar None was at 0. That was included. I didn't approach the Bar None. I included that as part of the county part of it.
Okay, I'd like to see you in future years approach,
Bar
I
None.
think everybody, all the towns and all the cities and the county should be invested in your budget. So I'd like you to make requests, and if you'd like us to help open the doors, I think the commission will do that. The $50,000 for crisis shelter services, how long has the county been doing that roughly?
I've been with the Youth Crisis Center for 3 years, and it's been my whole tenure. I can't speak to before that. Lisa is on 3 years as well as our finance director. So I can't account for that, but I know that the county commissioners have been supportive of YCC over several years.
And the
Every year,
the 100
Chairman, since I've been on 30-some years, they've helped. But it was 35 grand, and it increased in the last many years, it's been 50.
And the 118, we just did that last year.
You just did that last year.
That
for
was a bridge
program.
program, yes.
And is there, I don't know, with our current economic situation, I don't know that we're going to be able to fund all of this year. I think we'll try because I think we believe in you and what you're doing and your mission and the good you're doing. But if there's a reduction in the amount, what impact is it going to have to the services you provide?
There will be an impact, but we will do our best to absorb that impact and continue to meet the needs. My commitment is to, if you guys are able to provide funding for that program, I want to keep that program open because I know how important it is. As you look at the difference between the JDC numbers and our numbers, you know, we are the only other alternative than JDC. And I don't want us to take those additional 5 beds offline. I really don't. I want that to still be a program that represents Natrona County, our district courts and our circuit courts. Because the judges are really getting more on board with it and knowing that it's there and they're using it more and more. And I would like for us to continue to use that. But, you know, we'll make a commitment that we'll do what we can to continue this program for sure.
All right. Thank you, gentlemen. We appreciate it.
Thank you.
Thank you, too.
Thanks, commissioners.
We had Commissioner Roundtable discussion on for 3 p.m. We are going to skip that, and if there are critical pressing Commissioner Roundtable matters to discuss, let me know on a break. But I think we're going to move right into our next appointment with Denise Weiskup, Regional GIS Administrator.
Okay, good afternoon, everyone. This is a follow-up to the April 16th work session in which we initially proposed the 2025 flight area for Natrona County. And I'll also scoot forward. Better? Perfect. So yes, this is a follow-up to the April 16th work session in which additional direction was provided regarding the 2025 Natrona County flight. This is a flight that's in coordination with the State Department of Revenue. And also with the Casper area MPO. The Natrona County has chosen to participate in the flight, the previous 2 flight cycles. So for the past 10 years, Natrona County has expanded upon the MPO, but we're also this year able to take advantage of the coordination with the Wyoming Department of Revenue with the Eagle View flight, which is their oblique imagery. So given the direction that was provided by council, April 16th, we coordinated, and we being myself, in addition to Natrona County GIS, we sat down with the departments, namely Natrona County Road and Bridge, Natrona County Parks, the Assessor's Office, and Emergency Management to scope down the area of interest in order to find additional cost savings. So we were able to essentially cut out and trim an additional 322 square miles. And that brought down the overall cost estimate provided back from Eagle View to $288,000, which is a significant cost savings in comparison to the previous flight area, which was at $377,000 approximately. We were also given direction to provide estimates, more concrete estimates from Eagle View for the Casper Mountain LiDAR, which we were also able to obtain the estimate as you see in Table A. And there was also interest from the County Assessor's Office to obtain the additional add-in for the Eagle View Change Finder, which is essentially the application that they utilize to better assess properties to find specific structures or assets that may be missing from the tax roll. In addition, there was a request to obtain an estimate for the oil and gas change finder, which is specific to recognizing oil and gas assets that are not currently within the tax roll. So anything that would not be recognizable through the typical Eagle View change finder. The oil and gas change finder is able to more specifically identify tanks, pads, things along those lines. Okay. Do I have any questions so far regarding the information that's been provided in the memo and also in the exhibits?
I don't believe we have questions thus far.
Okay. One additional information I did identify inside of the memo in regards to the LiDAR, the elevation and derived products, namely the contours and the hillshades. This is one product that we're able to see a significant reduction in cost and also cost savings is because we're able to fly in coordination, or the county would be able to fly in coordination with the Casper area MPO. The MPO does only obtain contour and elevation data every 10 years. So if the county chooses not to fly this particular flight cycle, it would not be until 2035 when the next planimetric and elevation would be captured by the Casper area MPO. So in essence, additional cost savings can be introduced if we're able to coordinate with the Casper area MPO for the elevation data. So given this information, I think where we're looking presently, because we are looking to fly in 2025 in the spring and summer, we need to provide additional direction to Eagle View as to how they could be coordinating the flight area within Natrona County.
Very good. Commissioner North.
Denise, how extensive is that LiDAR? I know you have various different levels of it and everything else.
This is meant for namely topographic purposes. It's
Okay.
meant to define topography, and while the LiDAR will provide surface readback, it will not provide any subsurface readback.
Okay, that's kind of where I was going with that, was to see if that was
No.
how extensive it was.
It's namely the primary products that are derived from the LiDAR that we acquire are the contour information, which are what are most commonly seen on topographic maps.
Commissioners, what are the thoughts on this trimmed flight area, the reduction of the 322 square miles? Are we comfortable with that? The maps are in the packet. Map Exhibit A is the one that shows in, I think, hashed or dashes, the original areas. Is that right?
You are correct. The lighter shade of blue is the trimmed area. The hashed area was the original flight area that was previously defined. And as you can see, the reduction namely occurred in the western section of the original flight area, sticking namely towards the river location and the reservoirs. But there was energy development seen in some of the sections that were further to the west, so that's why they were continued to be included.
I'm not hearing any concerns or objections to the trimmed area, so I think looks like we can give you direction to go down that path.
Okay.
Commissioners, with respect to the LiDAR, that's a $64,000 item. We heard that if we don't do it, 2035 will be the next time it's available through MPO. Is that correct?
In coordination with the MPO, yes.
So it'll just be our next option to do it. Is that what you're saying?
Correct.
Okay.
Correct. So 10 years, 2 more flight cycles.
Okay. Any thoughts on, any strong feelings one way or the other on the LiDAR?
Mr. Chairman,
Commissioner Mellon?
I'm not against it. I see that emergency management's here. It was their strong feeling, I guess, to include it. And if you want, I don't know, would you want to speak to that inclusion of LiDAR, why you want it or not?
Yeah, if you would speak to the utility of LiDAR, I think that'd be helpful to the commission.
Thank you. Mike Cavalier, I'm Deputy Coordinator for EM here in Natrona County. So we use the contour stuff fairly often in our search and rescue stuff or our planning stuff that we're looking at, some of the wildfire response, emergency evacuations. That really gives us the literal lay of the land as far as the mountain is concerned. All of those topographic elements contribute to how we plan how long something is going to take, how many resources it's going to take, and that could be in wildfire response or it could be in search and rescue response. It gives us all of those details that aren't visible to us under the naked eye, essentially. We've been using the Esri product through the co-op for quite a few years now successfully, and it's been a really good product for us to leverage and help in our efficiency as far as that work is concerned.
Thank you. Any questions about LiDAR that? Okay. There are a number of people in the community that appear to be fond of Casper Mountain, as indicated by recent comments on certain proposed or maybe proposed in the future projects. So I think that 64,000 is real money, but I think it'll be a value that we can afford. So.
And, to supplement that particular comment, this data is available for the public, and especially the contour information. It is shared with our engineering and survey community for those specific reasons. It's one of the most highly valued pieces that we contribute whenever it comes to planning and design, especially for some of the new developments that are going through. So this information, not only are we using it internally for our particular field operations, but it's also a piece of data that is very valuable for different communities here as well.
Has there been, so does MPO, they do the MPO area for LiDAR, right?
Correct.
Was there any discussion about having MPO do the Casper Mountain LiDAR?
It is outside of the MPO area, so it is not within their scope. Federal highways would definitely not agree with that adjustment.
Thank you. All right. That, yeah, refreshed my recollection. Thanks for that data point. We have the assessor here, back there. The assessor add-ins are potentially $35,000 for the oil and gas finder and the change finder. Denise, what's the change finder? Remind me.
So the change finder is what the county assessor's office uses in order to look at changes in overall structures that are observed from previous flight cycles. So it actually takes a baseline year where you acquire your footprints, your building footprints, and then you start with that baseline, and then the next flight cycle, you're able to compare the two data sets. So because the Natrona County Assessor's Office already utilizes Change Finder, this additional cost is for the additional area of coverage. So that's what that specific item details. It essentially will allow them in subsequent years to observe if there's any changes of assets on a specific property.
Very good. Madam Assessor, why should we do these add-ins?
I believe that just with our job description that we're to discover and list, and knowing and getting through our cycle of reviews each year, the Change Finder has been very beneficial as to whether If we don't get a building permit, let's say for one area or one specific property, the change finder will help us find that, whether it is an additional structure, or if there was a structure there and now there's not, we are able to go in, look at the map, and either add it or take it off. And as far as the change finder for the oil and gas, I know that Converse County utilizes that. That part of it for us would be new. We've never have had the opportunity to look at it, so that would be something I would need to learn how to do as well. I did call Dixie this morning in Converse County to ask her about how it benefited her county. She loves it, especially when she's trying to find the new companies that are coming, old ones that are going, the wells that are shutting down or they're just newly drilling. She's able to find those rather quickly.
Very good. Any questions for the assessor on the add-ins, the change finder or the oil and gas finder? Any concerns with adding it? Let's go ahead and add that. And then really, I think the last area for guidance is probably the big one, which is, do we do 6-inch certified or 6-inch standard? Because that's $140,000 difference, it appears.
Correct.
Would you speak to that and make the case?
Certainly, certainly. And so just to give a bit of historical background as well, in the past with the previous 2 flight cycles, the county has essentially went through with what we classify as the ASPRS level 1 certification of imagery, which is essentially a grade of mapping accuracy that says, I'm flying this particular space and I have a level of confidence to say that this location plus or minus 14.5 inches is where it says it should be. So the reason that this is important, especially maybe more relationally to the county, the higher level of accuracy and precision from a desktop perspective, whenever you're performing desktop analysis, it informs other decision making. In that, for instance, if you receive a plat and you're drawing in a plat and you're trying to look for known reference points as boundary markers or reference lines, having a image that has a known level of accuracy and precision helps with the overall placement of an alignment whenever you're drawing in certain legal instruments. Is it meant to be a legally binding piece of information? No, but it's another resource that can be used in order to verify the accuracy of a product that's being received and that the county is essentially the steward of.
If we don't do the certified this cycle, when is the next time we'd have that?
It would be in
Update.
2030.
2030, 5 years.
Yes.
Commissioners, what is the feeling on whether we do the standard or the certified?
Mr. Chairman, it's like going in and buying a foreign car and they're asking you if you want the special heavy-duty gold hood ornament or not. I don't know what we really need during this entire discussion compared to what we have now. What do we really need? So I'm interested in getting what we really need. Now the bells and whistles doesn't sound to me like we need it, and the guys in 2030 can figure it out.
Very good. Any other thoughts on certified versus standard?
May I make one comment in relation? So the county has in the previous 2 flight cycles chosen to stay in alignment with the certified standard. If you fall outside of the certified standard, then it essentially is creating a potential and I don't want to say issue, but I am going to, in regards to using a resource for certain type of desktop validation. There's already been a precedent set to utilize a particular resource to perform certain functions. And if you're going to be lessening the overall accuracy and precision, then you have to potentially look and question the way in which certain operations will be performed over the next 5 years.
Go ahead, Commissioner North.
I think I know where you're going with that, but can you be a little bit more specific about what situations we would be using that we would have to have that clarity or that specific level of accuracy? Yeah.
I'm thinking that in regards to certain desktop operations in which you would like to have a level of information such as ownership alignments. As the county continues to build and expand, and plats and records of survey and other instruments are delivered, the imagery that's used as an overall reference would not be, I think, as reliable as or relied upon as it has been in the past.
Isn't that what you have surveys for?
Surveys are one form and supplement to the information, but oftentimes, instruments are received that are incorrect. And you have to be able to have, especially give your staff as many resources as possible in order to verify the information that's provided and submitted. Not everything comes in correct, unfortunately.
Yeah, well, the reason why I'm asking is because I have seen on both Eagle View and other things where property alignment is not accurate, not even close. And if
Correct.
we're already currently using the certified and it's not accurate, then
The Eagle View product is not currently certified. So we are requesting in this 2025 flight that the ortho imagery that Eagle View provides to us be certified. The current Eagle View imagery that is not in there is not certified.
well, yeah, I would definitely agree with that statement because I've seen it where the lines are way off on a lot of stuff on different things.
And what we have done over the past 10 years is essentially make a determination and decision that we're going to try and improve the accuracy of our data every opportunity that we can. So given a base resource in which you can introduce a level of accuracy, so as you begin to build that catalog of information and you have a known point at which you can say, hey, starting this day, we're going to start and improve. We're only going to continue to improve. We're not going to downgrade, because the moment you downgrade, then you're going to start introducing potential error.
I understand what you're saying. I don't necessarily know if it's worth the difference in price, but
Something else to just reiterate. So the state will continue to fly in their 2-year cycles, and they will fly at the standard, so that every 5 years, if the county makes the determination that they would like to have certified imagery that meets a higher level of quality and precision, you will have that as your base reference. And that's what we've used for the past 10 years. But the state that's flying at standard for a very specific assessor purpose will continue to fly in those 2-year cycles as the gap fillers. But if you can introduce the higher level of precision and accuracy every 5 years, because you already have done so, that would be the recommendation.
So, big picture question. When I hear the word certified, to me, that's kind of a stamp that it's true and correct and accurate in all material respects. Are you saying that the certified is not just a stamp of accuracy, but it's actually a higher level of imagery quality?
Correct. So the level of what we're trying to meet is the ASPRS, the Association for Photogrammetry and Remote Sensing standard of accuracy. We've requested that Eagle View provide the accuracy level 1, which means that imagery acquired at 6-inch resolution is required to be in a mapping grade accuracy of 14.4 inches, I believe, for a 6-inch pixel. So that's the level of accuracy and precision that we're requesting that Eagle View fly.
Mr. Chairman, I think my question would be for everybody, where are we if we don't buy any of this? Don't we already have programs that handle all this? We're getting along just fine.
Because you have participated in the past 10 years in upgrading your data.
But what if we don't really even need the upgrade? I mean, I don't know whether we need an upgrade or not. I mean,
I think that that's, if we would like to have additional departments come up and speak as to the daily use and value that the imagery provides to their resources, I think we can do so.
I don't think we need to do that. I'm aware of lots of people in the private industry that use this imagery every day. I can't remember if I used it at 7 a.m. this morning. I know I used it yesterday. I think that things on the ground change constantly, and I think good imagery is important for a lot of departments and the public in general. I think we really need to wrap this discussion up and decide whether we're going to do the certified or the standard. And I'm hearing maybe on my left a little consternation with respect to doing the certified, and to my right, it's been pretty quiet. So, gentlemen, do you have a strong feeling one way or the other?
Personally, I think you gotta go certified with it just simply because of the quality of the image that you're gonna get. It's not just us up here using it, it's public too, and it's other departments that need it.
Okay, to my right, I'm seeing certified. To my left,
I see it. Can we charge the people that use it?
no,
Or it just costs us the money and everybody gets to use it free, apparently?
unless we set up something crazy and we build and grow government to manage that and to assess a fee, which you can defend. I don't want any part
Which
of
would probably cost more money.
the
than
$20 per view, the subscription. I like the idea for a revenue generator, but I don't know I want to go down that path. So
I have
Commissioner-
always liked the gold hood ornament.
Commissioner North? I can go either way. But Commissioner Laird, are you then for the certified or the standard?
You know, I just don't know. I don't like spending the money. I wonder why they just don't throw that in. I mean, the whole situation has me befuddled a little bit. I can understand improving it with technology. I finally bought a new TV after 8 years and it's a little clearer screen, but one eye can't see it anyway. So, you know, it's whatever the vote of the commission says they want to do. I'd just soon not do it, and then at least we could say we saved a little money for the county. But for those who know more about it than I do, fine.
Commissioner North? Well, he's a certified guy, and I will break the tie if I need to. So I think I need your guidance. I think Commissioner Laird is a standard. Like pulling teeth.
How much again is the gold hood ornament?
145, 140 more.
Sure be nice to be able to actually see it and see if you could even tell the difference.
Okay.
But I'm good with it. I'm good with it if the commission thinks that that's the thing to do.
I feel like we're like it's the glacier here. We're taking a couple steps back, perhaps.
Let's just go with certified.
All right, then I don't have to take a position, but for the record, I was standard. All right, so we're gonna go
The
certified.
motivation was en route. Thank you.
Thank you.
Thank you.
Wow, that was tough. Um, Madam County, thank you very much. Madam County Attorney, I think you're on for legal updates.
Thank you, Mr. Chairman. For what it's worth, I use the mapping service very often, so. I use what we have, which I believe is certified, and find it very helpful, so. So as an update, there's not a whole lot on the agenda for this evening. One item, Clerk Good wanted me to make sure I highlighted was the agreement with Erickson for the e-poll book for the support. She would like that passed this evening, and that is also a requirement of the interagency agreement that we previously entered into back in March. That in that agreement, the county is required to contract with the state's e-poll book hosting vendor to procure no less than one on-site e-poll book subject matter expert for each election in which the module is utilized by the county. So this is just kind of an additional step and part of the requirements of our interagency agreement that we've already approved. Are there any questions about that? Okay. I think that's the only item on the agenda that I wanted to bring to your attention, unless you have any questions about anything else on there. If not, then just as a brief update on the land swap discussion, is still currently working on trying to answer some of the questions that were raised the last time we discussed it. I spoke briefly with the city attorney about the process, let him know that we have some parcels we're probably going to remove from consideration, and that we discussed putting together a draft MOU regarding this process. I'm not positive if he's been able to start that, to put a draft together. If he hasn't, then our office can work on putting a draft together as well. But we are at least in communication about that process and going forward with it.
As a recap, I might get this name wrong. There's the Saddle String strip of land off of Highway 220, and it's not CY Avenue at that point, but and I think there may be a fence
Just west of Webb Creek.
just west of Webb Creek, and we're taking that one off the table, correct?
So the Saddle String property is a different property. We've received an offer to purchase on that one.
Yeah.
So that one's
That
outside
one
of the
wasn't
land
part
swap.
of the land swap.
No, sir.
No, that was an offer to purchase, and we've been looking into that, so.
And my understanding is that YDOT does not have any interest in that parcel, either in terms of acquisition or drainage easement.
That's correct.
Okay, so then the parcels to be removed are the 3 lots across from the detention center.
I believe so. The sheriff, I spoke with him. He does have an interest in those parcels.
And I spoke with him too, and he confirmed that.
Yeah, for a possible future expansion. And then the parcel in town, which the Iris Clubhouse sits on, the issue with that one was the deed that the county granted to the Iris Clubhouse was never recorded. That's since been taken care of, so we no longer own it. So that one will be off the list as well. And then the portion that you're talking about, the old Alcova Road, I think we were going to remove that one because of the fact that there was a fence, and then there was some confusion about property lines there because of past road vacations that had taken place.
Just for clarification on that, there's another area in that area that Jared's aware of. That's not that particular spot, but it's a different area that's right next to it that there was some question about too, so.
I heard about that, yeah.
So that's county-owned property as well?
No, it's not,
Okay.
but it's that old Alcova Road
Right.
area,
And
and so.
And then we need to retain the sheriff's tower and the generator and small building at the base of it. Did you advise and that's for emergency services, and there were a couple other items on that particular. Did you talk to the city attorney about that one?
Not that particular issue, no, I have not yet.
Okay.
So it sounds like you would prefer just to retain that rather than having an agreement for access then?
Yes, correct. I think that there's enough stuff of the counties going on that. There's a structure at the base. There's, I believe, a generator at the base. We need to carve that parcel out. And I know we were going to have some pictures of that, but it sounds like we can let go of a lot of towers, but not that one. Other parcels on the potential land swap that I'm either forgetting or that are of some sort of concern or of key import?
The only other one I can think of is that parcel that's in the river. Did we get that taken care of for mills?
For the mills?
Yeah.
The city was going to move forward with a subdivision of that parcel, splitting it down the river. They were going to take the lead on getting it surveyed. I will be able to visit with Carter in a couple days, and I can get an update on where that is, unless you know, Heather.
I don't, I'm sorry.
Okay. I'll let you know, but yeah, the idea on that one is to reserve from the center line of the river to the north, and then we would deal with the city of Mills at a later point. But that the center line to the south would
Okay.
be part of the swap.
Okay, that's fine.
Yep, thank you. Okay, I think you have additional guidance on the land swap, and I'll visit with the city manager about where we're at too.
Okay. The only other issue I kind of wanted to bring to your attention was that we have several petitions to vacate public roadways that are pending. In the past, we've used different county employees as a viewer. There's one that's currently in the works that Mr. Hagler is the viewer on. Christy Turner, when she was here, was a viewer for one of them. At this point, Mr. Hagler is pretty busy and unable to take that on. So what I was wanting to ask was whether this is something that we could potentially request that whoever's petitioning to vacate public lands, that the commission require a deposit from them to cover that cost. I think we would have to contract with an outside provider, potentially an engineering firm, to act as the viewer, because I just don't think that's something that we can handle in-house at this time. And requiring a deposit of a petitioner is authorized by the statute in the process for vacating roadways. So it is allowed, but I wanted to make you aware and get your thoughts on
How much is
speaking.
it?
I don't know. I think it's going to depend on the particular petition to vacate. The one I'm looking at now is fairly small. It probably wouldn't require a whole lot of work, so the deposit would be, I think, fairly small. But we have another one that just came in that is a large subdivision. I think that one might require considerable work on the part of whoever the viewer is. So I'd have to consult, I think, with some outside providers to see what the cost might be, to get an idea of what to require as a deposit.
I think you should do that. I think that it is reasonable that it might be $250 on a simple one, and who knows, who knows what it would be on a more complex one. If you have some feedback, then I think we could adopt some sort of policy. Of course, we would want it to be a reasonable deposit amount, but I think we'd want or the actual cost, whichever is higher. So in whatever our policy is, whatever the requirement is, that we have that additional opportunity to pass through that cost, because sometimes it starts to look like a $250 job at the commencement. And then it becomes more complex and more time, and then I don't want to get stuck with a bill for $2,500 and only have $250 from the applicant. So let's make sure we build something that has that contingency.
Okay. Thank you for that. The other option with respect to that is that the statute does allow for a commissioner to be the viewer. I don't know if there's any interest in any commissioners wanting to take that on, but that is an option, just so you're aware.
I like field trips, but I think that it might not be, it might not be the best use of our time. So I think if we have engaged someone and maybe it lasts for a long time, or maybe it's just until we have a planner, which also may be.
Well, this
a
big
while.
money we're spending on this viewing device, we could just look at it on our tabletop and charge the guy $2,500 and help get a little money going
We,
here.
we did get the certified. I think Commissioner Laird, that's a wonderful idea.
I think so.
Yeah, I'll view them for you.
for the certified.
No, we're going down that path. I was against it. All right, you have your direction on that?
I do, thank you. And
So the vacation process, there's publication, I know it's a statutory process. Is that a P and Z review, or does it just,
No.
we get the viewers report and then the BOCC, we have to have a public hearing? Okay.
we do, yeah. I'm not quite sure how P and Z got involved. I think at some point, there's a petition form that came about that they distribute. When I was here previously, it always came to the commission and then to the county attorney's office, so. But planning and zoning doesn't have any input on that process.
A few years ago, it did sneak through the P and Z side of things for a little while.
Okay, anything else, Heather?
That's really all I have, unless you have questions about anything.
Commissioner Friel?
Thank you, Mr. Chairman. I wanted to make sure that you got the MOU that I sent out.
I did, yes.
Okay,
thank you.
and I did get a message back from Carter that said that there would be no fees for any remains that would be entered into it, and that they would need to coordinate with the coroner's office as far as the city would want to be the ones to put the remains into the columbariums and be able to track exactly what is where. I don't have those added in there, so I know those are two more lines that we needed added in. That's it.
Thank you.
So, Commissioner Friel, will you reach out to the one company and tell them that we have every intention of getting that, and if we can put our name on that particular mausoleum? I know that they had one and that there's some lead time if we don't get that one. So if you can sweet talk them and tell them it's just a matter of paperwork. Hopefully, Heather, we can get the MOU back in a position or condition that the commissioners can take a quick look at it and then get it over to Mr. Nelson. And I think that if that can be done before our next meeting, so you just, when you get it over to Mr. Nelson, you can say, client hasn't approved this yet, but just to keep it moving quickly, then they can run it up their flagpoles too. I don't know if it's realistic that we can get this on the next meeting. It'd be sweet. That's 2 weeks, it's the blink of an eye, but it's also, there's a little time there. Otherwise, it'd be my sincere hope that we could do it by our second June meeting. And then, did we have any other things we needed to do for engineering the concrete structure? Do you remember, was that the city that was gonna look into that?
The city was gonna work on the engineering of the foundation itself, and then we're still paying for everything, but their engineers are dealing with creating
As long as they
the
don't
base.
send us a bill for their engineering.
Yeah, exactly.
Um,
And I think I have it written in there that way, that we're working with engineering from the city, but that we're footing the bill.
Now, sometimes commissioners put their names on a plaque on the structure being built. I say we keep our names off of this one.
Just the people of Natrona County, I'd say.
Well, I
Is
think
what
we
you would
should
say.
do something that was more than just, but, very good. Commissioner Laird, maybe you and Commissioner Friel can work together on a plaque that has this, a statement, of purpose or,
It's like that one I sent
Philosophy.
you guys, the kind of the
Well,
wording that's on that one, if you
I
still
know,
have
but
it.
if you work through the specifics, there may or may not be some tweaking to it.
Well, then I think if we do that though, Mr. Chairman, I think Friel and I's picture should be down at the bottom.
I prefer not
With
to,
your
and
arms
Yeah,
crossed
I-
like that.
I'm
I
only
prefer
kidding.
not to, until my time comes, so I'll reserve it for that stone.
The fewer times your name is at Highland, the better.
At some point, here lies Steve Friel.
Well, okay. Do you want to take a 5-minute break and then deal with a couple more commission roundtable items, or do you want to just keep pressing through? All right. Commissioner Laird, roundtable items.
I don't have any right now. I guess we'll have one later after the or during the meeting or something.
A roundtable.
Well, the commissioner's comments, yeah.
Okay, well, we'll do that after the meeting or near the end of the meeting tonight. Commissioner North?
We've got one more meeting with the committee on the shooting complex. We've got a pretty good, I think we have a extremely good plan put together. And I'm proud of our results so far, but we'll meet one more time next Tuesday. It has to be submitted by June 3rd, and then they will start doing interviews, I think on the 17th of June, if I remember right. So we should, hopefully we'll move forward pretty quick. They'll make the short list and then they'll make the final decision, I guess. The committee will, their recommendation in August of this year. So we'll see, cross our fingers and hope for the best.
Commissioner Friel?
CNFR, everybody will start getting into town on the 30th, 31st. As far as putting it all together, the 9th through the 15th is when it is happening. They've got events downtown. It's 25th year. It's actually pretty exciting next year that Wyoming Sports Ranch will be open, and they've already worked on, it's going to be released at the CNFR, but that's going to turn into a mercantile. It's going to be like Cowboy Christmas for next year. So a lot of big things in that expanding. And then I guess the only other thing, the only question I have is that, Mr. Chairman, do you still want to, after our discussions with the library today, are we still want to get that meeting set up with John Griffith, or is that not happening now?
Well, I think the ball is in John's court, in that, I think we had a day and time, or at least a day, and then he said that's not a good week for him. And, I indicated my scheduling issues, for the following week, and I haven't heard anything back. And so I think we, don't have a meeting on our calendar, and if folks want to meet, that's great, and hopefully the library will be in contact with the foundation ASAP. So to answer your question, I think it's a maybe.
Good.
Nothing's on my calendar.
Good. That's all I've got.
Commissioner Milne?
I don't really have anything. I do have a question for Commissioner North, though, with the water. How's Midwest and Edgerton, that situation coming about? How's it going? Do we have any dates, prices, times, anything?
Dates, no.
Costs?
Well, we know what our cost is gonna be. But, they've got the plan kind of lined out. They've been working on that with, and getting that completed. Everything, every time I talk to Tracy, they sound like everything's going really well and they're right on schedule. So it's going to be starting here sometime within the next month or so, depending on what the weather is, I guess. That's about as much as I can tell you. They are looking at adding a few additional things, but that's not going to be reflective on the commission when they do. Right now they're considering putting in a filling station off Ormsby Road to take care of some of the people up there in that Antelope Hills area and Homa Hills, so they don't have to drive all the way down to Poison Spider and get it from Pioneer. So I think that's going to be a positive thing. They were kind of talking about doing that, and if they've incorporated, they're changing their service district a little bit so they can incorporate some of that when they do that. Since they're the only one that has a line out there, it makes sense for them to be the one that does that. But I haven't heard anything recently as far as other than everything's going well, the design's going well, and they're moving forward. So that's about as much as I can tell you right now.
So if they're incorporating some of the scope creep, are they expecting us to pay for the scope creep as well?
No, we won't be on the hook for that at all. At least-
And then as far as the wind power up there and all that construction going, have they taken all the activity up there in consideration and try to do some simul ops or what have they even?
I
talked
have
to-
brought that up and I haven't heard a whole lot. I don't know if I'm not sure what they're doing. I was told at one time that they had a water source other than the line going up there, but I don't know.
Right, but they're going to be coordinating with their digging as well as with the wind, so that we don't have blades sitting on the side of the road waiting to go across when they got a ditch.
Oh, no, because where they're digging, where they're actually doing it is further north.
Right.
It's only a 9-mile stretch south of Midwest Edgerton, so it's not even going to interfere with that at all. No, it won't interfere with that at all.
Okay.
So that was one of my questions too, that project. And my first thought is that, it kind of goes to the Commissioner Mills' point of scope creep, and that is, our deal was a not to exceed or up to $850,000. I can't remember if that was based on a percentage, because clearly the project is going to cost more than $850,000. So do you guys recall, was it a percent of the entire project not to exceed $850,000?
I thought it was just $850,000.
I think that's, if I remember right, when I talked to Commissioner Friel, that when they were before the SLIB board, that's what they said they had. So that was kind of committed. Was that your understanding?
Well, the letter,
No, I mean, this is when they were before the SLIB board,
the
so.
letter that the county signed, that you signed from December, said up to $850,000. I don't know.
That would have been in January, because I wasn't here for that vote. I was down at.
Well,
That was the first meeting in January.
you signed it, it's December 2023, but it doesn't matter. The language is up to $850,000. So what they told SLIB, I mean, I think we ought to resolve it Commissioner Friel?
So when they were at SLIB, they basically had all the money and then they gave some money back so they could be used elsewhere and didn't accept it. But I do believe it was up to $850,000.
And so, like, how would it be less than $850,000 is my question. Like if it's 5% not to exceed $850,000 or 25% not to exceed $850,000, then it'd be clear how it could possibly be less than 850.
Because originally we said up to $850,000. When they went down there, they were given a substantial amount of money, and they said, "Well, we already got $850,000 guaranteed to us," so they didn't take it, even though it was being given to them. So originally we said up to 850,000. When they were offered more, they were like, "Oh no, give the extra to those guys because we have 850 from the county commissioners." That's how that all happened.
So, it is what it is. The question is, gentlemen, is this a coming fiscal year budgeted item, or is it going to be the following year? I know we don't have exact on timing, but are we going to need to include this in our upcoming budget?
My understanding is that it is going to be coming up. It's going to be this year. They're going to, once they have everything in place, they will crank it out. It'll be a short-term deal. They've already got the federal funding for the majority of it, and this is basically supplemental along with the SLIB money. So, yeah, it's going to be coming up.
I will make sure that we have that number somewhere in our budget. I'll make sure the clerk puts that in somewhere.
Mr. Chairman.
Yeah.
So since it's up to, yeah, we can put it in the budget, but we don't pay out until we get an invoice.
Correct. And my question was, should we expect the invoice to come in the next fiscal year? And I think Commissioner North is pretty confident
Indicating,
that they'll be far enough along or even
they
potentially
started on
completed that we'll get a bill.
They've got the design.
That's it.
No, that was a big deal.
Do you remember though, Mr. Chairman, Mr. Alaman came in, or wrote us all a letter, wanted 500,000. We allowed 850. I don't remember the up to part. I just remember that we allowed 850.
Commissioner Milne, did you have anything else for roundtable?
No.
I'm trying to recall. There's obviously a lot going on. We have a full day tomorrow, starting with maintenance and Garrett at 8:30. Our last appointment is with the assessor, Salisbury, at 4. We have scheduled an hour and a half for lunch. We, I think, have plenty to do and could have a working lunch. And I think that's kind of what I had been planning and I'd been talking to Michelle about. But I wanted to give you all a heads up that we ought to probably do that. Are there any questions or concerns with having lunch together and ordering
Will there be
out?
burritos there?
No burritos. We are going to get a menu from the Cottage in the Bluebird. So you'd probably need us to let you know by 10 o'clock or something like that. And you have those menus on our desks tonight or tomorrow morning. Okay. And let's not get 2 sandwiches from one place and 3 sandwiches from another. Do you want to do Bluebird tomorrow or do you want to do Cottage?
Cottage.
Bluebird has a good sandwich.
Okay, there we go. Commissioner Milne and Commissioner North. If we spend 15 minutes on this, the sheriff's in the back, he may take it out on us in a bad way. All right.
Somebody decide, because Peter won't.
All right, no, okay, here we go. Here we go. Right or left, Commissioner North?
You just, I don't know, I don't have a preference, so.
Oh my gosh, we're gonna go cottage. We're gonna do Bluebird next
I
time.
think you're discriminating against me because of age. The Bluebird has a really nice sandwich.
I just can't believe Peter made a decision.
I didn't
He
really.
read it off.
In any event,
Are we done?
um, we're hopefully close to having another individual to serve as the Memorial Hospital Board trustee. We still are looking for one additional individual that has some healthcare background. If you have ideas of people. Okay, does he have medical? Okay, let's,
Who's the one you have in mind?
I'll let you know.
Okay,
I think I already have, but,
you might have, I just forgot.
oh, I had a whole list, but, I don't think it's that critical or I'd remember. So I think we'll, Commissioner Friel.
Mr. Chair, could we make sure that we, on a future agenda, have Jesse Fouché, he's Live Oak Environmental, you and I talked to him. He's the guy I talked to you about the other day that is doing the carbon capture project out on Falls Ranch, and wanted to have WDEQ come in here, except for we couldn't have them in here because we didn't have a meeting on that date, but we can get WDEQ on the phone when we have him in here. So I'd like to set up a time to have him come in and explain just what the project is and what they're doing.
I think that'd be a good idea. I've heard of a private water line extending a number of miles out along not along the Hat 6 road, but kind of between the Hat 6 road and the interstate. I guess as a follow-up to that, I have long had on our schedules my absence for the first 13 days of June. So I'll miss that first meeting in June. I think Commissioner Millen is going to be here. So is that your plan, June 3rd or 4th or whatever?
I don't know from day to day.
Well, the expectation is that you will be here, so be here. And you can.
You tell me I'm here, I'm here.
Okay, just in general, or?
You know,
All right.
Overall,
I'm here for Dallas.
yes.
You know.
Okay, we will recess till